And we're back.
Mo's on the phone, he's just outside.
Oh, okay.
Oh, okay.
We're gonna start with donning and doffing. He'll just go last. That's fine.
Yes. So, yeah, so the next thing is where we left off on the last thing is donning and doffing of PPE. As you can see from our notes that are up there, donning, which means putting things on, putting them on. And a good way to remember that is don, O-N, there's the word on is right in the word. And the word off is right in doffing. Okay, I'm gonna underline maybe just in red or something. That's the easy way to remember it. Donning is putting it on, doffing is taking it off, on and off. Okay? All right, you missed the most important thing of the entire class, Mo.
Oh, I had to guess.
So if you look up there, what's underlined in red, donning means putting on. The word on is right in the word.
Okay.
And doffing is taking it off, and the word off is right in the word. Okay, so if you're ever confused about donning and doffing, just look at the word. All right, so we're gonna practice donning and doffing. So if you recall, donning means the first thing you're gonna do is you're going to practice hand hygiene, right? Whether that's hand sanitizer, or in the case of C. diff, you're gonna physically wash your hands with soap and water. Okay, then you're going to, the best thing to do is remove jewelry. It's not, some of us do have jewelry, but I see most of you do not have a lot on your hands when you're working, mainly because it can poke through the glove. But, it's not, it's not a mandatory uniform thing here, but we do ask people to keep it to a minimum and not have a lot of jewelry hanging around. You're gonna perform hand hygiene. The first thing you're gonna do is put on what? What's the first thing you do in donning or donning, right?
Oh, we're gonna put on our gown.
Put on the gown, right?
And our gloves.
You're gonna put on the glove first, okay? Put on the hands and arms one sleeve at a time. Fully cover your torso from your neck to your knees and your arms all the way to the end of your wrist, okay? And then you're gonna wrap it around and tie it in the back, okay? And then the next thing you're gonna put on after the gown is gonna be what? Nope.
The mask.
Mask or respirator, depending on which one.
Yeah.
A surgical mask for contact or droplet, okay? All contact, we don't require a mask.
No, we don't.
So, but we're wearing masks now anyway, all the time in patient rooms, so you're gonna wear at that point, step 3 is gonna be your mask or N95 respirator for airborne, okay? And then step 4 is going to be what? After mask?
Goggles or face shield.
Goggles or face shield, if required, okay?
And gloves will last.
Gloves will last.
Why are they last?
Because your hands are clean and you're touching clean things. Okay, you're touching a clean gown, you're touching a clean mask, you're touching clean goggles. Okay, that's why they're last to go on and they're first to come off, okay?
Oh, first to come off.
Last to go on and first to come off are your gloves, okay?
All right.
The last thing you put on your gloves, and the other reason you put your gloves on last is because you're supposed to actually pull them over the sleeve of the isolation gown. Okay, so that nothing can get up inside the sleeve. So when you put that glove on, you put it over the sleeve, okay, the cuff of the isolation gown, so that seals that up and you're not getting anything up inside your sleeve,
The
okay?
purple glove or the regular glove?
Whichever glove you're wearing, doesn't matter, okay? But that's why the glove goes on last, so that when you pull it up, you actually pull it over the sleeve of the gown. Does that make sense?
Mm-hmm.
Okay, all right, so let's practice that,
I got one for each of you.
okay?
We got plastic bags.
So, Wanda,
Thank you.
Mo, Phil,
I got me.
good catch. Good catch. We got gloves and we got masks. Now, this might not be the appropriate size, so grab 2 gloves out of there, please, and pass it. Yeah, you can grab it and just pass it around. These might not be the right size gloves that you always wear or the right size mask that you always wear from a N95 perspective, but take one and pass it around. Who wants to be our first guinea pig?
Okay, what do you need?
We need someone to demonstrate and show us the steps.
The steps of what? Donning or doff?
Donning, well, you gotta be donned before you can doff. Can't take it off unless you put it on, so you're gonna do both. All right, so stand up, Mo. So first thing you do is what? What's the very first thing you do?
Before you,
Wash your
Right,
Hand
so you-
hygiene.
Hand hygiene, there you go. Hand hygiene. And you should do it before you take the gown out of the package. Because if your hands are dirty, now you've contaminated that gown potentially with whatever's already on your hands. All right, so then you would take the gown out of the package. All right. You're gonna unfold it so the opening's at the back, all right? Put your head out, put it over your head, put your hands and arms in. Okay, and fully cover your torso from your neck to your knees.
Do our fingers tip going these ones?
Okay?
yeah,
And these ones, because they have the fingertip things, yes, and that helps to keep it from sliding up, okay?
they're not the best, so they're just for training, so.
Okay. Okay, and these don't require a necktie because they have the, go over your head. And then tie it in the back, okay? So it's all tied in the back,
Yeah.
it's tied so that it's not gonna fall off you or slip off.
No.
Okay. All right, so next thing is what, after the gown,
Put this mask on.
right?
So we got one of these ones on, we take this one off.
Yep.
Put
Yes,
this on.
correct.
What we do with ours that we took
Toss
off?
it,
Throw in the garbage.
if you
Then we
wanna
gotta
get a new one,
another Right?
yep,
Yep, yeah, there's no shortage of these anymore, so we don't have to save them in bags or keep them locked up anywhere. So
See, this is
you
wrong.
missed, you missed the strap there, Mo. So
Any wrong?
Okay, how you-
Any
there's two
wrong?
straps.
This one go here.
no, they both, you hold them both.
Do. You can either pull that bottom one up and over, or put them both over at the same time.
Oh, they both go in the back?
Yeah.
Yeah, they both go in the back.
That's how you know, because you know this goes on.
One-
One goes up high and one goes down low.
One
So
low,
we go like this.
one goes under the ear, one goes above the ear, yep.
Yeah.
You just gotta check,
And then
yeah, there you
Get your
go.
nose so that the mask is tight. Make sure you got a tight fit all the way around, is the key with the N95. Okay, and then what's next after the mask?
Goggles,
Goggles if we had them, okay, and if you, or face shield if required, okay? And then next,
yep,
then your gloves, yeah. Pull it on. And then you're gonna pull it actually up over the sleeve. You wanna pull it over the sleeve of your, yeah, kind of tuck that, yep, up over the sleeve. The ones with the cuffs are a lot
and then, well, that
easier.
might not be your right size.
Yeah, the ones with the cuffs, yeah, if you had a large glove, it would fit over there. But you basically want it to be over that, so,
Yep,
yeah,
like
exactly
that.
like that. Okay?
Yeah.
So that's the way. Any questions on that, anybody? Okay,
Now, how do you remove it, Mom?
now, we're gonna doff. So look at the steps for doffing. They're basically almost the reverse, not exact reverse, but pretty close.
Yeah, there you go.
You go gloves, pull them off like that, and then pull the other glove off.
Then you take the other one like this.
Well, no,
Yeah.
hold on to that
We
other
gotta
one.
hold on to it, yeah.
Or you wanna, you could be back here,
Now
I'm
put
with the
your
trash.
thumbs
I'm gonna throw it in the garbage.
Put your thumb through that,
Like that.
yeah. Yep, and then you throw them through in the garbage all at once. So you're gonna throw those in the garbage. Okay, so that's first. Next would be your goggles or face shield. And again, you always wanna be pulling that away from your body. Understanding that if there's anything splattered on that goggles or face shield, you don't want it to really touch it with your hands. You don't wanna like pull it like this off from the front. You wanna grab from the sides, because it's less likely to have anything splattered on.
Then we take the mask off like this.
From the string.
Nope, 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 no, mask stays on.
Oh.
The reason the mask stays on is you could have contamination on your gown. Okay, if you have contamination on your gown and then you already have your mask off, you could spread that contamination to yourself, okay? So the gown now comes off next, and you wanna pull it away from your body. These have the rip thing, so you can
You
actually
just
rip it.
Yep.
And then pull, you wanna grab kind of from the outside, yeah, or from the inside, pull it away from your body, so you're not touching the contaminated area, and roll it towards the middle. Yeah, perfect, okay,
That's how you do it?
and then, yep, roll it towards the middle, so all the dirty stays on the inside. And then now the mask, and again, lift away from your face and up and over.
You're supposed to grab the.
Grab the straps.
The straps.
Yep, there you
Grab
go.
the straps and just go like this.
Just make sure we go like
That way it
this.
comes away from your
Oh,
face.
okay.
That's gonna be hard to
Okay.
do, but can't you break it?
Yeah, like.
Can we just break it?
Well, the problem is if you break it, number one, you could snap the elastic and hurt yourself.
Yeah.
I don't want you snapping your own face with the
What's the
elastic.
last thing?
Number two.
It's a flip top.
Oh, it's a flip top?
And number two if you're pulling it, you could, you have the potential to cause like whatever's caught in it, the particulate or the things that are caught in the mask to kind of spray back out. So just nice and slow and smooth, take the elastic off and it should pull right straight off of you. Okay, and then we dispose them in the garbage. I know during, N95 respirators may be reused, and there are times like during COVID at the peak of it, when we had a shortage of masks, we were asking people to keep them in a paper bag because they can be reused a number of times. We're not there now. Okay, we don't have to reuse our N95s. And then the last thing, perform hand hygiene as you did. All right, very good. Thank you, Mo. Demonstration. Who's next?
I'm gonna be like this.
Yep, that'll work.
Okay,
Go
Wanda,
ahead.
let's go. Let's see how you do. So first thing, always, yes, hand hygiene. Very thorough, very nice.
Slow.
You have to let it dry a little bit.
Yep.
Before you put on those
Gloves,
gloves.
yeah.
Mhm.
Well, I put on those gloves first, but I'm gonna stop.
Yeah.
Mhm.
You can't pull them up over the sleeve.
I really can't.
They're already
I
tucked
never
inside
even
of the
thought
sleeve.
of something being wrong.
Again, this is the approved method from CDC, and this is kind of what,
This is what they want.
what we're supposed to be doing, and it's, again, scientifically, they've discovered and vetted out that this is the safest way to do it. Does that mean if you miss a step or you do it the wrong way, you're gonna get sick? Not necessarily, probably not, but better to do it the right way and better yet, show people the right way.
The right way of doing it. Uh-oh. You forgot. You don't know yet.
Take off
Her
from,
mask.
yeah, that's okay.
Yeah, you should take your surgical mask off first, but that's, we get
You
it.
can't wear both of them?
No.
I did that before, but what's wrong with that?
Well, number one, you don't need to wear both of them. Because the particular respirator keeps out way more than the surgical mask does. Number two, in order for the N95 to work properly, it needs to have a tight seal to your skin. That's why we make the guys shave before they put it on, before they get fit tested. It has to have a tight seal around here, okay? And if you have that other mask on there, it's not a tight seal.
Now, how you gonna take all that off?
Well,
You pass down the trash can? No, thank you.
Put one inside the other, that's good technique. Goggles, face shield,
There we go.
yeah, keep them away from your body.
Wonderful. Rip that bad boy.
Have it away, make sure you pull it away from your body.
I
There
always
you go.
do that part,
And roll it to the inside.
Like that?
Well, what you wanna, just be
Yeah.
careful, Wanda, that when you do that, you're not touching the side that's content, the outer part of it. You can roll it, you usually roll it to the inside, so you're not touching the outside, okay? And then take the elastic, and pull the elastic.
You usually don't wanna touch the front of the mask, cause that's contaminated.
Yeah, that's why you're just
That's why
pulling.
we take
If you
the
take the
side.
two elastics in the back and pull them up and over, the mask will come off.
I mean, it'll lay there for a second, but then it'll come off.
It'll come off as you come forward with the elastic, it'll come off.
It's good to know.
Yeah, the less touching, the whole thing's designed to get everything on you in a sensible manner, but more importantly, to take it off so that you're not recontaminating anything. Okay, Rita, very good, Wanda. Thank you.
Thank you.
Okay.
Yeah, because they gotta be trying to see this.
Mhm.
Finger in there.
Fingers won't go in. Okay, first,
That thing won't go in there. Y'all get hands on James first already?
It needs to fit, one fit off.
Yes.
'Cause they got the extra large on my floor.
Yeah, these are just cheapy ones we use for training, cause we don't wanna get the real good, nice, expensive ones
All
for,
right, plastic bag ones, thank you.
yeah,
That would be hard, don't think.
yeah.
Yes,
These are just ones we use for training.
yeah.
Okay.
Okay. Next, step 3. Mask.
I know. Pull over. Cause I realized normally when I was on the floor, I had to like have my glasses on, it was difficult,
To be able to
cause I didn't know
see.
if to take them off and put them on.
Oh, yeah.
So I'm like, oh, yeah. Which one is which? The longer one?
Yeah, you got it, you
Yeah.
got it.
There you go.
Over here?
Mhm.
Okay.
I would put one over your ear and one
Yeah.
under your ear.
It is, but it won't stay up here.
Yeah, that's the one, yo, you got both,
Got a both of them over there?
yeah, there you go, that's the one, that's under,
Okay.
yeah, that's good.
I was trying to fill the longer one.
Oh,
though.
yeah.
Okay, alright. Okay.
Okay.
Now you're.
Taking that off.
Yeah, no, those are, yep, those are goggles.
Then those are your goggles.
Yeah.
And then last but not least,
Gloves.
It's gonna be a tight fit. but you can-
Yeah.
It's gonna be a tight fit
Take
for
the one
me.
right there.
Yeah, mine
Yeah,
is larger,
that's good.
excellent.
You try to be nice to them, right, so you don't, so they don't want to not be nice to us. On both, yeah.
okay, very good.
Got it on.
Got it on there.
Yeah.
Now, taking it
Moving
off.
then. First thing. See the garbage?
Yep,
Yes, right there.
Gloves.
okay.
Next, goggles or face shield.
Yes.
Now gown. Nope, not mask.
No. Oh, God was a.
Gown.
Mhm.
Then gown. Because you don't want to, especially if you're in an airborne room or a droplet room. If you're in a droplet room, and you have.
Yeah, that's if you
That's
got on
right,
the
this will
face
come
shield.
off last.
Yeah.
Yeah, that's the face
Yeah,
shield, I'm looking at.
if you're in a droplet room and you pull
Yeah.
that gown off and you don't have your
Yeah,
mask on,
that's
you could
right,
be
yeah.
spewing droplets into your mucous membrane. So you want to keep that mask on until almost everything contaminated is gone.
Serious, I never even thought of that. Taking that mask off.
Mask should be the last thing before hand hygiene.
And we
Okay.
put it down.
Yeah, the very last thing. The only thing that's after is hand hygiene.
There you go,
There
perfect.
go. Nice, Sharita.
Go this way.
Mhm.
Throw it away. And what's the last thing you do?
Yeah, well, you could have kept it, but you don't need,
I
you know.
know.
Okay, thank you, Sharita. Becky, better up.
Fair enough.
You do
Yeah,
everything.
hygiene.
Good at it.
Put my gown. I wash my hands. Well, this is the hardest part for me is to get back.
Sign it in the back.
Yeah,
See, it won't even come around.
Yeah, just sign it in the back.
yeah.
Oh, is that what it is? Is if you don't do it in the front?
Cheaper
No.
ones, they don't make them long.
Yeah,
Oh.
I know, yeah, most people.
Sign in the back. That's hard to do. It's like walking with your eyes closed. Now,
Then I'll
Mask,
take my
yeah.
mask
Mhm.
and I'll put it on. I go like this.
Yep, that's how, yep, that's
Is
how you
that
put it
okay?
on.
Because
Well,
I've
that's
seen them
exactly how you
do
do
that.
it.
yeah, that's perfect.
I seen Mr. Bruce do
Yeah.
this one day in a training.
Mhm.
Okay.
Okay.
That's gonna be a tight fit, but
And yeah, right over the sleeves. These ones, it helps if your finger's in the hole. If your thumb is in the hole,
First, yeah.
Oh, and
makes-
this?
it makes it easier for the thing to go over, for the Love to go over.
But you can use this?
Mhm.
That is good.
Sure.
They were being cute. They really did. I was like, wow, that's cute. Hey, there you are.
Yep.
So now, do me a favor, look at the way your mask is, okay? And see how like there's gaps up by your eye, like up on the side?
Yeah,
Everyone see
yeah.
how there's like gaps around her?
I could see the
N95?
gap. I could feel
One of the
it.
reasons for that is because you have the other mask underneath.
But if I took the mask
Took
off,
that mask off, it would be able to make a tight seal to your face. So that's why they don't have you wearing two. All right?
so I'm
Okay.
taking it off.
Oh, no.
Look at your steps.
Oh, wait a minute. We're moving.
What?
Oh, we're moving. We're moving.
Yeah.
Now we're
Gloves go
moving.
on last and they come off first.
Yeah, sorry.
And, well, no. Oh, yeah, goggles, face shield, you don't really have that on. But if you had goggles, you would take them off next.
Okay.
And then your gown, yeah. Now he's wrapping to the middle, exactly. Very good, excellent.
And
And
then,
your mask or respirator.
and I do it like this. I don't know why, but I take one at a time down. Can you?
Yeah, you can, I mean,
Is it a
You
way-
shouldn't,
right
because
way
you
or
see,
wrong way?
because That's the wrong, because you really.
but then you're
'cause you-
fumbling with it,
Yeah,
it's
you're,
moving
and
around.
it's touching
Oh.
you
You
and.
want the least amount of like jostling of the equipment as you take it off.
Mhm.
Because if there is something contaminated on it, you don't want to be like pushing it back out into the environment. You want to be like very controlled and get it right in that garbage can.
Okay,
Alright.
so next time I just.
Nice and slowly, very good. All right, Kapil. Last but not least, my friend.
He does it a lot, you can tell.
I never like couple of times I put on passing glove.
Oh,
Yeah.
really? Okay.
Yeah. Oh, I got a bumper. It's not fixed.
Okay, so gown, now what?
I got goggles. I don't have it.
But now is mask or respirator. Will be next.
Old one. I will take this first.
Okay, and if you had goggles, now you would have put them on before that. And now what's last?
It's not fit for me.
Sorry.
Yeah, that's
Yeah.
It
tight,
was hard, tight for me.
tight squeeze. So if you normally wear large gloves and you get there and you only have medium available, is it okay to just not wear any gloves?
Oh,
No,
no.
I would
That's-
try
you
to
cannot-
not-
you cannot
I would
not
try
any
to wear
glove.
You're always better off,
Yeah.
with just even if it's tight and it's a smaller size, you're still gonna protect yourself more than if you
I'm
wore
good.
nothing.
I'm
Okay.
good.
Coming off, doffing now.
Yep.
Gloves first, correct?
Gloves.
Next would be what, if you had them
I
on,
got the
goggles.
goggles and then this one.
all away from your body, yep.
This and
And use the inside of the gown to wrap it up. Yeah,
All right.
and then last, yeah, next to last.
Yeah. this tie.
See, that's what I have a problem with.
Or you can always use your finger and go under it
Under,
too.
okay.
You just don't wanna touch the front of it, cause that's where all the
Oh, okay.
bad stuff
Oh,
is.
I can go like that? That's what you're
Yeah,
saying?
you can do that, you just don't wanna
From
touch here, like from here, the sides, yep. You just don't wanna touch the front.
And hygiene. Very good. All right.
When we doing like, when we doing garbage when we first come in, when we go in every room, so we change our gloves.
You
every
gotta
room?
change your gloves in
Yeah.
every room, that's what I've been
Yes.
telling everybody, but they hollered at me. The
Mhm.
one girl hollered at me.
What one girl?
I can't tell you who. You want me to?
No.
Cause she hollered, I couldn't believe that she
You
had.
didn't tell me outside of here.
She made a, you know,
A
like,
girl in our department?
Mhm.
Well, first of all, we have plenty of gloves. We are never gonna.
And
be
that's what I
grudging
told her. I
safety
said, don't
equipment,
worry about that.
because you have the potential
So
to
take 'em
cross.
off.
But she didn't wanna keep changing them.
Well, that's too bad. You have to change them and do hand hygiene in between every room. All
See
right,
that, Fred?
have to do it.
Oh,
Cause if
Yeah.
infection control was over there, up there, and they were doing an audit, they would see that practice and they would say
We
something.
had a person who worked for Stericycle a few years ago, removed for not doing that. Because she refused to change gloves in between every room, picking up the sharps, and we said, well, then you can't work here.
Mm.
So, no, you have to do it, have to do it,
Mhm.
all right? Okay, so we did this, we donned the PPE provided, we explained the steps we were following, and we did the same for doffing, and we looked at some of the mistakes that we made, all right? All right, so reading door signs, so the signs we're gonna show here obviously are not the same exactly as the ones we have, but we have examples of what ours look like, actually, so I will pull those out at this time.
Oh, wow, you brought that.
Of course. They may have made some changes to some of these because sometimes they do that, but I don't think so since March. Okay. So, do you know what precautions to follow when you enter a patient room? Okay. How do you know? How do you know what precautions to follow? It should be, right?
Yeah.
Sign should be on the door, so you follow those precautions. Exactly. So that said, what does that tell you? What does the sign usually tell you? What are the things you can glean from whatever sign is on the door? What are the things you learn? You go to a patient room, there's a sign on the door for a precaution. What do you take off that?
First of all, it lets you know what type of room it is.
What type of
And second of all, it
precaution,
lets you
right?
know
Caution it is.
What else is on there
PPE that
usually?
you need to use,
Yeah.
it lets you know.
PPE, which PPE do you use?
Right.
Right. Anything else you can think of that might be on there?
Just let you know, a patient in there, something's going on with them.
Right, right. If there's something specific for that room or that particular bacteria or virus or pathogen, okay? So if you have questions about the information on a sign, or if the right PPE is not available outside the sign or outside the room, then make sure you call your manager or contact the nurse manager so that we can get you the right information and the right help. So let's practice identifying door signs and deciding what's required, okay? So you got on page, where are we here? Page
40. 40. Is it 40 or 41?
41.
41.
You're way past this, Mo.
Yes,
Yeah.
yeah, 40.
1.40.
Yeah.
Okay, so on 140, what is the question? I gotta do what you were doing, so I should have a
Oh, yeah.
participant book next to it.
It says,
Okay.
how do you know what precautions to follow when you enter a patient room?
And you guys said it already.
Yep,
The sign on
they
the
already
door,
said it.
right?
Yep, just
So
make sure you
let's
put your
fill in that
notes.
blank. The first question, how do you know? You follow the sign on the door. And how tells you how to choose the right PPE? Basically the type of precaution, right? And we already reviewed the different precautions and the different PPE. All right? So remember standard precautions? What do we say about those? Those are the things we do when?
Always.
Always, every day.
Yeah.
You know, wear your gloves, wash your hands. That's standard precautions. Okay, to follow transmission-based precautions or precautions that mean that whatever the patient has can be transmitted to another person, you have to pay careful attention to the door sign. So you know which PPE you should be wearing and what cleaning solutions are required in the room. Okay? So you're gonna follow the posted isolation signs at all time, and we're gonna go through what some of them are. So these are the examples of our signs, all right? So this is for what?
Contact.
Right, okay, so. Over on our page 1.41, under contact, okay, what precautions or what PPE is required in this kind of
It looked
room?
like gowning.
The gown and,
Gown and gloves.
and the gloves, that's it.
So for us, gown and gloves, they give some other information that may apply to nursing or may apply to other folks, other caregivers, dedicated non-critical equipment, and private room. Okay, that's more for nursing and medical staff end of things, but the gown and the gloves and the hand washing is really what is required for us to know. Okay, it has some information on here about visitors as well and staff, and you notice it says in addition to standard precautions, right? Because we always do standard precautions. So That's our version of a contact. The one that they put in there is just kind of a generic one that you might see at any hospital. But again, very similar information, and tells you exactly what to do. All right? So for this contact one, the required PPE is gonna be the gown and the gloves. Okay? The next one that we're looking at here is airborne. And this is our version of the airborne sign. Okay? So, tells you what?
Close the door, wear a mask.
Yeah, in addition to standard precautions, which is wear gloves, wash your hands. Okay, what kind of room has to be? Right, and it's also gotta be a negative pressure room. So those are those rooms that have the little interstitial space, the little ante room in between. So you have like a little room that's like usually got a sink or a little hand washing area or something inside of it. And then you have the patient room inside. Those are typically the negative pressure rooms.
What if
They
they
will-
ain't got one of them rooms available? Can
Well,
they just put them in the regular room?
They should
I
not
only
put,
got
an-
one of them on my floor. Y'all, you
I got
them?
two.
Okay.
they should not put an airborne patient into a non-airborne room. There, if we're in a real pinch, they will bring the portable HEPA units into the
Yeah,
room.
okay, they put the Hubbard,
Right,
them usually be in the
but that
room.
doesn't necessarily mean it's an airborne just because the HEPA's in there.
Oh,
Okay, they put the HEPA's in there for a lot of different things. But if they're in a pinch and they don't have an airborne room, that's one of the things they can do. But they try not to. They try to, because the air actually needs to be monitored. So in the negative pressure rooms, they have a little box usually on the outside of the room
I
that
see it.
shows
Yeah.
if it's a negative or positive, and actually can give
So
them
that's the only room
information.
they supposed to put them in.
That's what they're supposed to put them in, yes, if they're in airborne isolation. Okay, I'm not saying they don't use other rooms because sometimes they're either waiting for a test to come back or they started out in that room and then they convert to an airborne isolation while they're here and they have to wait to get them into another room. So there's a lot of things that happen. I just don't want you guys going running out there guns ablazing saying, oh my gosh, this patient's not in the right room, because there are reasons why they might not, they might have come in not under airborne precautions and then it changes during their stay. That can happen too. Okay, but what type of mask is required in here?
N95.
Right, and 95, okay. And then, again, there's more information on here for patient transport. What is the other important thing to know about hand hygiene with these?
Wash your hands.
With
With water.
With soap and
soap
water.
and water, okay, hand hygiene must be with soap and water. Not, you notice on the contact one, it says soap and water or alcohol-based hand rub, okay?
That's or two. That's, you got airborne in your hand,
Oh,
not
duh. Okay, so this is an either or as well. The only one that's not either or is the Contact Plus, and that's not even one that's listed here within this guide, okay? So the airborne, that's what's required. Next one, we're gonna skip this because that's not one of the, that's one of ours, not theirs. Next one is droplet precautions. So we know with droplet precautions, the infectious material is contained where?
Normally on the surface.
Well, where does it come from? Where does it come from within the patient?
Oh,
From the mouth and.
yeah, the mouth of the nose. or
Droplets,
whatever.
yeah, droplets. It comes from things that
Yeah, I
come
didn't
out of
know
their
if you
nose and
wanted us to
mouth.
Say the mouth.
Yeah. Respiratory secretions, you know,
Yeah.
things that come out of your mouth or your nose or the
I always
droplets.
thought it was like blood, you know. when I
It could be
see it,
blood, but
I
typically
always
it's,
thought droplets mean there's blood in there,
No,
dropping or something, but.
yeah, it could, but
I just
typically
learned
it's
today
more
that-
respiratory
okay.
stuff when we see these,
Yeah.
typically. Okay, so again, in addition to standard precautions, a private room is required, okay, and then again, it's more nursing related stuff. Non-critical equipment dedicated, mask required, okay, what kind of mask?
It looked like a
Regular
regular.
surgical mask, yep, you do not need that 95. And then, again, hand hygiene with either or. All right. And then again, we have Contact Plus, it's not listed on here, but we have Contact Plus that we have devised specifically for C. diff, okay? And for that, gown and gloves is required, hand hygiene performed with soap and water specifically, and cleaning must be done using Clorox bleach wipes, okay? This is the only one that we should be using bleach for, all right?
The Contact Plus.
Contact Plus, only one we use bleach. If you're using bleach for anything else, stop.
Well, I thought we used it for, airborne too.
Nope.
No. Only Contact Plus,
Only Contact Plus.
only Contact
If the
Plus.
patient, is it an option if the patient wants bleach?
If that's the case, talk to your manager, or we'll talk to infection control. We don't want to get in the habit of, we certainly want to take care of our patients and we want them to feel at
But they
ease.
told me they didn't smell anything when I
Well,
used the other stuff and
Yeah, but
they didn't feel
that's,
like it was being cleaned.
smell doesn't make it clean.
But I told them,
Chemical
you
makes it
watch me do it.
Yeah, and the chemical we use kills every single pathogen except C. diff. More than likely, if the patient is making that request, we are gonna follow the patient's request. Because, you know,
I
we
do,
want them,
I do, I
we want them
follow
to feel comfortable and safe. We're not gonna like knock you for not listening to what the patient wants, because that's who we're here to take care of ultimately. But we also should take that opportunity to maybe educate the patient a little bit. We're not using this other peroxide thing because we like, you know, we wanna make you nervous. We're using it because it kills everything, and it kills all the same stuff as bleach, with one exception. C. diff. That's the only thing it doesn't kill.
They don't gotta
Please
tell the
don't kill
patient
C. diff,
that.
you said?
Peroxide.
You don't tell the
It's the
patient
only thing
that.
that doesn't kill it.
It kills
That's why
everything
for-
but C. diff.
Contact
You don't
Plus,
say that.
we use bleach.
Well, I mean,
Just-
it's, you can, but you know, it's not something we normally say, but you could.
Just say
Oh,
the
okay.
peroxide wipes kill all the same pathogens as the bleach does. Kills all the same things, all right?
Okay. Just not the smell.
Okay,
not-
but okay,
Yes.
all three of these though,
Because that's what they
like when
want.
we see the little yellow thing by the door, and we clean it, okay, we do it.
I mean, you should see these on the door.
Okay, Contact Plus is the only one that we changed, the paper towels and the curtains too,
Yes, at discharge.
at discharge. Okay, that's just Contact Plus, the rest of them, we don't have to change the,
Don't
No,
don't we
Well, we do
change
we do the curtains at our isolations,
every,
Okay,
all
okay,
of
all,
them?
that's what I
but
thought.
All
you don't have to change it, yeah.
Okay,
Curtains, we do all isolations.
all isolation.
And shower curtains,
contact-
we do every room.
No, no, no.
No.
No, they stopped me.
Isolations.
Chris told me to stop doing it.
Isolations.
Yeah, isolations.
Yeah, he told me to stop. He said I was using too much.
Yeah, no, you only supposed to do them at
He said,
isolation.
why are you doing them? I said,
Yeah.
I
Yeah,
thought you
most
supposed to
people don't
change
use
every
our
time
showers
people leave.
anyways.
Yeah, most people don't use my,
So,
every
yeah,
now and
No,
then.
they use
Isolations.
mine.
So curtains, isolations. Okay. All right, any questions on those three different types of precautions? And really, the fourth one is more one we put together for contact lenses. But they want to talk about that on the test, all right?
Okay.
No? Okay. All right, so again, things we've talked about here, knowing the pathogens. We reviewed some of the common pathogens. We've talked about following, cleaning, and disinfecting steps properly, such as clockwise or counterclockwise, clean to dirty, top to bottom, wipe in one direction, okay? We've talked about wearing PPE. Hey, Steve.
Let me see, can I see?
Oh, absolutely.
Talked about wearing PPE, the proper PPE for the right job. Again, as indicated by, you know, the sign on the door and what the precaution is. And we're gonna talk a little more about hand hygiene. Okay, if we haven't talked about that enough, we're gonna talk about it some more, because I don't think you can ever talk too much about hand hygiene. Hand hygiene is the number one way to break the chain of infection. And we talked about that chain of infection early on, and the number one way to break that chain is by washing your hands properly and with the right solution, okay? And with the right technique. So why do you think we perform hand hygiene? Why do we do it? Why do you wash your hands?
So it'll stop the germs from spreading.
Prevent germs from spreading?
Right. We prevent germs from spreading, I guess, how?
From us and from the patient.
Perfect, exactly, both ways, okay? It protects both the patient and you and the other staff, okay? So proper hand hygiene is, again, I mentioned it, the single most important factor in reducing the transmission of pathogens via person-to-person contact, okay? So what are the most important things you need to do? Okay, so let's review the steps, okay? They're saying if you're using a manual paper towel dispenser, you should advance the dispenser before you wash your hands, okay? We'll go do some hand washing down the hall, okay? But to avoid actually touching the paper towel until your hands have been thoroughly washed. So you're gonna turn on the water, adjust it to a comfortable temperature, okay? Some of ours adjust and some don't, depends on where you are. Take care to avoid splashing water on the countertop or floor, which could result in a slip and fall. Okay, wet your hands thoroughly. So you're supposed to wet your hands first, okay? And then take some soap. Now, we have people that call us and say, well, these soap dispensers only give me a little tiny bit. That's not enough to wash my hands.
You can go as many times as you want.
That's one answer. The other answer is if you're not wetting your hands first,
That's
then
why
yeah,
it's
it's
not
gonna dry
sudsing
up in your hands a lot quicker if your hands are dry. So wet your hands first, then get some soap. And if you do that, you probably only need one pump if your hands are already wet, okay? Wet them thoroughly, dispense the right amount of soap, rub hands together using a rotating motion. So you're gonna be like kind of rotating them. Be sure to cover all areas, front, backs, okay, between fingers, okay, and knuckles. A little bit above your wrist, okay? Okay, get everything clean, especially like in the palms, you can do a little circle in your palms. You can even like make sure you get in between all your fingers, okay? Real thoroughly in between your fingers, backs, fronts, okay, a minimum of how long?
50 seconds.
At least 15 seconds, 15 to 20 seconds.
The
Um,
happy birthday song.
Happy birthday's good, Zippity Doo Dah's good, Yankee Doodle's good, any song that lasts 15 to 20 seconds, whatever music you love, insert song here. And just hum it in your head or hum it out loud or whatever the case may be. Okay, for at least 15 to 20 seconds, then rinse hands completely. Make sure to take a look at your hands, make sure all the soil is removed and repeat it if necessary, okay? Dry hands thoroughly using a clean paper towel. Okay, dry it, turn off the water faucet with the paper towel to avoid recontamination, okay? And then dispose of the paper towel in the trash can. All right? An alcohol-based hand sanitizer or Purell is not a substitute for hand washing when hands are visibly soiled. So much like Felicia mentioned with disinfecting a surface, where we have to remove the soil first and then disinfect, same with your hands. You have to, if you're coming with bloody or muddy hands, and then you have to wash the soil off of them first and then disinfect, okay? So that's again, a reason why for certain things, we use soap wash versus hand sanitizer. Because hand sanitizer does not wash anything off of your hands. It just reduces the bio load on your hands, okay? All right. All right, so what are the most important things you need to do to follow proper hand hygiene? The most important.
That we need to do to follow it?
Yeah, what do you need to do? What are the things I just explained that are most important? Yeah,
Mostly
so tell
just
me.
add water to your hands and soap and water.
Water on first, yeah.
Put your hands first.
Apply the soap. We're gonna scrub for how long?
15 minutes, 15 seconds.
15 and 20 seconds.
15 to 20.
And then what? Then what do? You just walk out?
No, we're gonna dry with a
Yeah,
paper
we gotta rinse first, right?
Oh,
Rinse it
Yeah.
off first.
Rinse,
towel.
dry them with the paper towel, then what? Turn off the
And then
water.
turn off the water with the paper towel.
Yeah.
Close the paper towel and come.
And then throw out the paper towel, okay? All right, excellent.
I wanna write that down, Felicia. Even though I know it, I think I might not know it.
Okay, everyone follow me.
Uh-huh.
We're gonna take a field trip down to the sink.
All right.
Was that good? Okay.
Mhm.
We'll come back.
We'll come back.
Okay, all right. I down towards the bathroom, let's see if one of them's up.
Oh, okay.
We can demo in there. So again, keep in mind. Covering all surfaces. Then. Okay, thanks, Aaron.
Okay, now we move it back and the door is dirty.
Why is the door dirty?
This is not as dirty, it's been contaminated, it's been touched.
Well, hopefully everyone that's touching it has clean hands, don't they?
So didn't I get that germ right back on me?
No, everyone that touched that door should have clean hands.
Grab another piece of.
Some people will.
Yeah, that's what I was-
Involved in-
I was gonna.
Okay, who's first? Who's our first? All right, let's see what we do. First. So. Earlier, are you singing anything?
No. Happy birthday, happy birthday to me. Oh, tell her happy birthday. Hope she enjoys it.
She's been at the beach all week, so yeah. She's at her lake in the beach, so she has a pre-birthday week. Okay, dry them off real nice.
Supposed to push it away from you, ain't it?
Yeah,
Or is that just stop?
I mean, once you've installed the soil, there shouldn't be anything you're pulling up for you, but. Okay, thank you. Good, you're next. Wet, so. Thorough, and with some fingers. Go up your wrist.
I never thought of
Yeah.
Yeah, I took it off the day just because. I'm mindful of it.
On real nice. Good.
But that's not low enough for me. You would change it at that?
No,
No, I wouldn't change it.
but that's what you want.
Yeah.
Yeah, that's tomorrow.
Okay, very good.
Oh.
Hey, Ernie. Ernie?
What comes up?
Count it 12 seconds. Count it 12
Oh,
seconds.
I like,
Yeah.
yeah, I would.
Oh, I thought I did.
Nobody.
What were you singing? Were you singing something?
There's something in my head.
All right, pick a longer song.
No. Did they open up the,
15 to 20 minimum.
the second in crime? Did they open that up? Oh, yeah, let's see what goes.
All right, very good. Anna, jump on up.
Yeah. Okay, thanks.
Number 15. There you go. Thank you, Wanda. And Sharita. I was good to hear all your
But
singing.
say if I had my training, say I'm telling my training, well, we gotta watch training, and they do it quick. So I say,
Oh, yeah, you have to say something.
so
Oh,
it's-
that's not long.
I mean, cause I keep thinking I'm not involved, I'm not involved.
You're the trainer.
You're their trainer?
You're the trainer.
I know,
You have to
but
train
how much
them.
can you say?
Everything.
You can,
You can.
but they, remember I did this with someone and they came back and told you.
That's all right. They can say, they can tell us anything.
They're showing you the right way. Guys have the authority and the power to do it.
I did it to one person and then she was like, I'm not doing it, and she came right down to the office and y'all sent her right back up.
Yeah, there we go.
Yeah.
Okay. Thank you, Sharon. I mean, there's always gonna be times back in you tell people it's all in the face. The right way to do it doesn't mean they're gonna do it.
Yeah, I know, but you thought I was trying to be a boss, but boss.
Yeah, the boss.
Trying to show her the right way.
This is a part of what we do.
Yeah. Well, now you're gonna have the credentials. You're gonna have the certification to prove that you know what you're talking about. All right? And it's gonna allow us to say the same thing. You know, Becky has the credentials and she's showing you the right way, so follow the right way to do things. All right? Okay, excellent job on the hand hygiene. All right, so we're gonna wrap up this chapter, or this section, I believe. Yeah, we're getting close to wrapping it up. What am I looking at here? Okay. Okay, so all these behaviors we've talked about, knowing the pathogens, following proper cleaning and disinfecting techniques, wearing PPE, performing hand hygiene, all the things we've talked about, work together to create a safe and healing environment. So something as simple as washing your hands can make a huge difference, all right? So now we are going to
You're the right page.
take a few minutes to review everything we learned around these 4 behaviors.
Okay.
So what are the 4 behaviors? Knowing the pathogens, following cleaning and disinfecting techniques, wearing PPE, and performing hand hygiene, okay? So we've got the flip chart notes all around here that we've talked about throughout this morning, okay? So you can certainly look to those, okay? To talk about some of the things we do. Preventing infection by use of PPE. You're gonna see a lot of common themes, okay, with all of these. The common themes being wash your hands, use PPE, okay? Making sure that we're doing the right procedure. Those are really the common things, okay? Are there other things that you think of that you would add to a list of how to prevent infection or prevent spread of infection? What are some other things you can think of that we didn't
Stop
cover?
the spread.
Yeah, things that you think could stop the spread of infection that we didn't cover.
Well, it's a couple of things, I'm quite sure.
What do you think? We talked real quickly about one of them, which is having proper vaccinations. You know, we can stop spread of infection by, you know,
Not
making sure
coming to
that
work
we're,
if you got a
don't
cold.
come to work if you're sick, knowing that if you're properly vaccinated, you could certainly carry the bacteria or the virus or whatever it is, but you may not get sick from it, okay? So again, making sure we're doing the right things, those are things that we need to be doing and training people on to prevent the spread of infection. All right, so things that we are going to use, techniques, okay, we talked about this, the key techniques, we're gonna review those one more time. Clean what? How do we clean?
Top to bottom.
Top to
Yeah.
bottom, yeah.
Yeah, clockwise,
Oh,
yeah.
clockwise.
Yeah.
Oh, yeah, I forgot about that.
Yeah.
Clockwise.
Or
The right
counterclockwise.
tools.
Clean to dirty, exactly,
Dirty.
yeah.
And,
High too low?
Yeah,
Top to
high, low,
bottom,
yeah.
top to
oh,
bottom.
yeah, top to bottom. that's
Okay,
top
and
to
we're gonna
bottom.
use the right procedures and we're gonna wipe in one direction, right? We talked about not going like
Yeah,
around in
yeah,
circles,
yeah, yeah.
just one, it can be a direction, you know, it's called unidirection or one direction
Never even paid
wiping.
that any attention.
But you do it, I've seen you do it, you wipe a mattress and you go like this, one
Yeah,
direction.
yeah, I
back
do
and
that with
forth.
the mattress,
You
but
don't
not
go
on
like-
the table.
You don't go like this, you typically go back and forth, one direction,
And
okay?
I even do that on the table too,
Mhm.
one direction. I
Yeah,
don't know what I'm thinking.
you do it, you just don't know that you do it, okay? Okay,
And one of the things, we also use a task checklist, which is our 7 steps of cleaning.
Yeah.
So that's like a checklist for us. We follow the 7 steps and we make sure we'll get everything in that room if you follow those 7 steps. So that's like a checklist for us.
how do you think your cleaning tasks, what page here? What do you have here? So we're on page 1.43. How do you think your cleaning tasks, your cleaning and disinfection tasks prevent the spread of infection? How do you think what you do every day prevents the spread of infection?
Because we stop it. We
Stop
stop
it.
the spread by wiping it,
Right.
by disinfecting it.
Right, and by breaking that chain.
Yeah.
Okay, so what other techniques do you use to break the chain? Besides wiping?
Oh.
Right here in the, you got it here.
It's all here. You can
Use
cheat.
a
I know.
PPE.
Oh,
Yeah.
the cheap.
Yeah, use PPE,
You
yeah.
don't use
Yeah.
PPE?
But,
And use it
Change gloves
properly.
between.
Yeah.
Yeah.
Change
Chest
gloves.
gloves in between,
Yeah, wash hands,
Hand
right?
Right.
hygiene, those are
Hand
always,
hygiene.
you know?
always that we prevent the spread of infection, okay?
Just be aware? Is that what you're saying?
Yeah, we'll just be aware of those things that we do, okay? So the next thing we're gonna kind of, and again, this is review and wrap up of things we've been talking about all day. Next thing, go to page 1.44 in your book, okay? And I want you to fill these in, okay? On the reason why. So clean high to low, clean to dirty, top to bottom. Why do we do that? Why do we do that? I'm asking.
To stop the spread,
Yeah.
Right, but why do we do that? Why don't we clean low to high?
because
No.
it's clean from the top more than it is at the bottom. The
Right, so you're
bottom's
taking
being
the,
used.
Been used more.
you don't wanna knock stuff down onto something that's already been cleaned or recontaminated. So you don't wanna recontaminate. Why would we go around like clockwise or counterclockwise?
Are these on the answer, or do I have to write them out, or are they on there? Okay, wait, next one,
No, they're not.
okay, then I'll write them out.
They're in the
Oh, they're-
facilitator guide.
No, they're not.
So-
No, I was saying I'll write them on here so everybody have.
Right, but they're in. our-
Yeah, I know they're in our guide. I wanted to make sure it wasn't in theirs.
So why do we use this to clean high to low, clean to dirty, top to bottom? What do we call that? That's kind of our what?
No, that's our daily, how we do our cleaning.
Our standard process,
Yes.
right? Our standard process. So following a standard process does what for us? Why would we follow a
It makes
standard
it
process?
efficient, it makes it
Yeah,
Better work,
what was that?
for the better work.
better work,
Better, more quality work, but also make sure what? Make sure that,
that we're not leaving any contaminants in
yeah, that we're not missing anything. Exactly. Make sure we're not missing or skipping anything. Areas that are clean are not recontaminated. We talked about that. And what did I say about this stuff? It's not something that Felicia and I made up. This is something that comes from where?
From this place.
Right, from the AHE, but it comes from CDC, scientifically based backgrounds. It's not just something we decided to be a nice thing to do, okay? It's scientifically based, okay? So why would we choose the right tools? Why do we need the right tools?
I think that is on the thing. If you do another click, I think click.
No.
Oh, no. Okay, it just says it here. Okay, there we go.
It's not,
Okay, no, never mind.
Okay, all
because
right.
this page is before that.
Yeah.
Okay, why do we choose, why, you said the right equipment, tools and,
At least I don't see it on here.
No, it's not. It just has the picture and then the
I know,
facilitators
yeah,
note.
no, I know that. but it
Yeah, so
doesn't
no.
Actually show it.
no, we don't,
Okay.
we're still on this.
Okay, so why is it important to choose the right equipment?
So you know what you're going in the room to do, how to clean it. So you use the right equipment.
Right, and that allows you to do what?
The job effectively.
if you're right,
Well,
job.
Yeah, do it effectively. So using the flat mop instead of the string mop, like we used to use, does what? What does that help us do? Prevents,
Spent the spread from going
Yeah,
from
from room to
bathroom
room,
to
exactly.
room.
exactly.
Is it okay to use a mop in the bathroom and come out of the bathroom and use it in the?
No.
We should always do the bathroom last.
I say I do the bathroom last, but do you use one mop in the whole room? Or you gotta change mops? Cause the one lady told me, and she's a patient, she said I should change my mop when I came out of the bathroom.
Well, if you did the bathroom first, then yes.
No, I didn't.
Well, then in fact, you are changing your mop when you come out of the bathroom. You're doing the room first, then you're going to the bathroom and then changing your mop.
Yeah,
Right.
yes.
So you are changing the mop when you come out of the bathroom.
No, I mean, she's saying why I'm mopping.
She's saying mop the patient room, then get another mop for the
Yeah,
bathroom?
She
No,
said
it's
2
not
mops
yet.
per room. And I told her, I don't know, but I'll find out.
No, we don't do that. We do one mop per room.
Yeah.
Mhm.
So it's 1 mop.
Especially, well, that, it's, again, assuming we're doing the bathroom last.
I do the
If you
bathroom.
went and mopped the bathroom first and then went to do the room, that's a no-no.
Yeah.
No.
Always do the bathroom last, but we
Yeah,
use
because it's
one mop per room.
surprises. I always say they surprise. It's a surprise, so you don't wanna do that one first.
Right, you wanna do the room and then the bathroom and then change the mop. Okay. Okay, so why would we wanna select the right chemicals? Why do you think?
Cause the one that's gonna disinfect the, area, that's why we use the chemicals.
To do the job, right?
They do the job right with the,
Yeah, to kill all the
Just
stuff we're
remove,
trying to
yeah,
kill,
trying to
right?
kill,
Yeah, do the
yeah.
job right. So if we use the wrong chemical, that can cause the pathogen to spread, okay? So we wanna make sure we're using the right disinfectant that is for that specific pathogen, okay? Another reason for selecting the right chemical, and we didn't really talk about this much, but the reason we don't use bleach on everything is because of what we call surface compatibility. Bleach is a corrosive chemical.
yeah.
So you will see, if I use bleach every day on a table like this, within a very short period of time, a month, 2 months, 6 months, you see it all chalky and white. So when you see your overbed tables all white and chalky and kinda like discolored, that's the bleach. That's because they're using too much bleach and it's actually bleaching out. It's a corrosive chemical and it will corrode the surfaces. So we don't want to use bleach any more than we have to. All right, so that's another reason to choose the right chemical. Okay, what's the difference between cleaning and disinfecting?
Clean and remove and disinfect like destroys the bacteria.
Yeah, exactly. Cleaning removes the soil and dirt, okay? And disinfecting removes and kills the microorganisms and decontaminates the pathogens, okay? So cleaning removes soil, removes dirt. Disinfecting kills or decontaminates, deactivates pathogens, okay? All right. All right, so how do we have quality checklists that we use to monitor completeness? Do you have anything that you check off or that you look at to make sure that we're keeping things, that we're doing everything completely?
Yeah, we have a checklist, we
We
have
got
a
7-step thing.
Yeah,
that we
7
come in
steps.
and-
seven step. yeah.
7 steps is our checklist to make sure we've done everything, okay? And then we also have quality inspections that the managers do to check to make sure we're doing everything, all right? So that's why we use quality checklists, to go through and make sure everything that we're supposed to clean has been cleaned, that we're not missing anything, that nothing got skipped, and make sure that we're up to standards. Okay. All right, so now that we've reviewed the way we clean and the way what we do to prevent and control the spread of infection, we're gonna see how much you remember, okay? Any questions before we get started?
Nope.
Okay. It's gonna put everything together and then we're gonna move on to the next section, okay? So, I think this is where we use these cards, right?
Yep.
Yes, okay. So we're gonna have 2 groups. Why don't we split it right down the middle?
Okay.
Actually, sides of the table. You guys are one group, you guys are another,
Yeah, that's good.
okay?
Perfect.
And we are going to take turns turning over cards. I think there's 2 sets of them, the lines and the techniques. Oh, crap.
Need help sorting through them, or?
Yeah, I thought they were all sorted because they were all like,
They may have, maybe last time we used them, they didn't get put in, right?
yeah, she sorted them by type of card, not necessarily by like the technique and the why.
Mhm.
Okay, so let's just, you know what, we're just going to go like this.
Okay.
I don't know if we can do this. How can we pick you all? I think there's a couple different sets in here. Yeah, we're never gonna get through this. Okay, so
You wanna just use the one
just
group
spread 'em
and then
out.
just all of them work together?
let's just spread them out.
Yeah, that'd probably be
Let's just
the
spread 'em out.
best way. And then if we get the same question more than once, then a different person.
Yeah, because there's, should be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 of them.
I'm gonna put this on the chair.
Yeah.
Right? Makes sense?
That's 16.
But it's
Make sure
12,
I'm
34,
not-
50.
So give me one more and then we'll see if there's any that are the same.
I'm gonna get some water when it's time.
Okay, let's just hold on to those for now. Okay, so what we're gonna do is, we're gonna take turns. I'm gonna hand you people on this side of the room are gonna pick a card. Okay, any one of these 16. And then people on the other side of the room are gonna say, find the card that matches, okay?
Find the card that matches the
Find
question.
the card that matches the question they ask. So Mo, you go first.
Which-
Just pick any one and
Yep.
read it,
To kill harmful pathogens and keep diseases from spread.
okay? So to kill harmful pathogens and keep diseases from spreading, what would the question be? Why would
Why
we?
would we use PPE?
No,
Does
PPE doesn't kill
kill
anything.
infect-
Oh, it said kill.
Does PPE kill
No.
pathogens?
No, it just stops the spread. What should we use? Say it again?
To kill harmful pathogens and keep diseases from spread.
There's this one right here,
Yeah.
the counterclockwise.
Cleaning.
This was what we picked.
What did you pick? Okay, that's close.
So,
What?
Okay, that's
Yeah.
close.
No, but
It must
not
be something better.
exactly it.
Yeah, the one.
Why do we disinfect? Right, exactly. We disinfect to kill harmful pathogens and keep the diseases from spreading.
Ah,
Okay.
yeah,
Okay.
I get it. Now I got it.
Okay, pick another one from here. Wanda, will you pick one and read it? Doesn't matter, we're going through all of them anyway.
Yeah, I think these are some more.
Or surface that has not been cleaned effectively cannot be said to be properly disinfected or sterilized.
A surface must be, what does it say? A surface
A
what?
surface that has not been cleaned effectively cannot be said to be properly disinfected or sterilized.
Okay,
Why we do clean before we disinfect?
perfect.
Yep.
yeah.
Before we clean, before we
Right, we've
disinfect.
gotta get rid of the dirt
Yeah,
before we can
yeah.
disinfect. Okay? Mo?
Yeah.
You pick one.
To understand the precautions you need to take when cleaning in that room, such as PPE, chemicals, and equipment.
Okay, to understand the precautions you need to take in cleaning that room, okay?
Why we use PPE?
Well,
Nope.
how do you understand?
What the sign is. what's on
Well,
the
say it
door.
again.
To understand the precautions you need to take when cleaning in that
Oh,
room.
to understand, we pay
Yeah.
attention to the
Attention to the
sign
signs.
before entering the room.
Perfect,
The
perfect,
sign is on the door.
okay,
That makes sense.
okay, pick another.
To protect mucous membrane, skin, and clothing from contact with infectious agents.
Then that would be, why do we use?
Now, that's the PPE.
Yes, as soon as he said it. Pick on.
Yeah, cover your mucous membranes and make sure you don't get infected. All right. Okay,
Next one.
next.
To
Pick
pre-
another one.
to prevent transmission or pathogen spread through close respiratory or
Mucus?
mucus
Membrane,
membrane contact with respiratory droplet
Secretions.
secretion.
Yeah, the one.
We just said
What does
why
it
we
say?
use.
Yeah, did you give her the one you just read, Mo?
No?
No, this.
No, okay, got it.
That all had to do with droplet.
Okay.
To prevent the
Oh,
transmission of
droplet
pathogens.
precaution.
Droplet precautions.
Why do we use droplet precautions?
Yeah,
Yeah.
those are all
We
for
said
droplet.
membrane.
Okay.
Yep,
Yeah, those are all droplet precautions. Okay?
Okay, we're almost getting there.
To
we
break the
got-
chain of infection when the routes of transmission is or are not completely interrupted using standard precautions alone.
Used standard precautions alone. And why do we need to learn about the chain of?
Yeah.
Yeah,
Perfect.
Gotta be something with the chain.
Perfect. Okay,
To make sure cleaning is performed in a
methodical, yeah.
methodical manner and nothing gets skipped.
Clockwise.
Clockwise, right here.
Oh, yeah, that's it.
Why we clean clock and counterclockwise?
Yeah, well, yeah, what do we?
That's the one we picked up. This is it, right here. That's the one.
Clockwise.
Or why do you use transmission?
Oh, that might be it.
not for that question,
No.
Yeah.
No, not necessarily.
but that one could be an answer for the other one we just did.
Oh, we could, you use, these could be different answers? I mean, like,
Some of them probably could be.
That's why we
but-
clean from top to
There's a
bottom, the
best
top to
answer.
Yeah.
bottom one on there. Ain't no talking
So
about
what's
it.
the question again, or the answer actually?
Why do we?
Are you
clean-
cleaning a clock?
No, this right here is.
Okay,
I was thinking the 7 steps.
So- Why not be, is it up and down one, is it top to bottom one on there?
what are we doing, are we doing clockwise or clockwise pattern, is that what you're asking, or is it, you're asking?
Yeah, I'm asking this right here.
Okay, you're asking this right here.
Mhm.
Why do we make sure it's cleaned in a methodical manner and nothing gets skipped? That's following the right process. That's just the overall following the right process, okay? Remember, we started by saying, wear your PPE, follow the right process, know your pathogens, that's know your process, follow the right process. Some of these could be a couple different things.
Yeah, this is
Okay.
very tricky right
So
here.
next one,
Let's see. To remove visible dust, soil, and organic materials such as blood, secretions, excretions, and microorganisms, and prepare a surface for disinfectant. To remove visible dust, soil, and organic materials such as blood, secretion.
What do we do before we disinfect?
We clean it.
Yeah, that's what you're looking for.
Clean from, do we clean from
Nope.
cleanest to dirty?
Nope, that's just not what we're looking for. It's a simple,
Oh, it's a simple one?
yeah,
Oh, follow the cleaning
No.
procedures.
nope,
What
what we're doing, right there by your hand.
Why do we clean?
Why do we?
Why do we clean?
yeah, why do we clean?
That's the question we're
We're
asking.
gonna clean first, yeah?
Yeah.
Well, yeah.
Yeah.
Okay, because we're preparing the surface for disinfection, that's why we clean. Okay, feeling a few more?
To reduce likelihood of spreading contaminants from areas that are more likely to contain infectious agents to areas that are less likely to be contaminated.
Okay, so what does that sound like? You're going from an area that's got infectious agents to one that may not.
PPE.
Cleanest to dirty.
Yep.
Cleanest to dirtiest.
Cleanest to dirtiest,
Yeah, that's
yeah.
right. That's right, that makes sense.
And it says, why do we clean from cleanest to dirtiest?
But it, yeah,
Why do we clean from cleanest to dirtiest? Yep,
goes with that one, the technique.
This-
okay,
Research and science has determined that following this cleaning process is the most effective way to break the chain of infection and ensure pathogens are not spread.
This is it. Why we use PPE. right?
No. Research,
Oh, tr-
why,
Why we use the transmitted base precautions.
Research and
nope, it's why,
determined that
it should be, why do we follow cleaning process taught here?
We already did
Oh,
that.
yeah, then we tried,
No, we probably used it already, right?
yeah. For this one, to make sure cleaning is performed in a methodical manner,
Mm-hmm.
so nothing get missed, I put that is,
Counterclockwise?
Oh, yeah.
yeah,
Cleaning process taught here.
yeah.
So why do you follow the cleaning process taught here? Because research and science has determined that following this process is the most effective way to break the chain of infection. Okay,
That was that, what was it?
Yeah. next one,
MDROs are examples of environmental hardy pathogens that can cause infections that are resistant to many antibiotics and harder to treat and require effective environmental cleaning to be removed.
You think that's it? Patient care?
What do we say MDROs are?
We
MDRO,
said that they were, what's the name?
Multi-drug resistant
multi-drug
organism.
resistance,
So is there one here
like
that says that?
MRSA and
Or is
stuff
that
like
one we're
that.
missing? Wait.
Might be
This
one. No, we're missing.
I found it.
There it is.
Here it is.
Why do we need,
Good to know. See,
why do we know about multi-drug resistant organisms? So that's one like MRSA, yeah.
MRSA.
Methicillin resistant Staph aureus.
Okay, that one
Okay.
goes with that one.
Yeah, you give one to Wanda.
To ensure that pathogens are not spread through the facility by uncovered cough and sneeze.
Make sure we're not spreading things through coughing and sneezing.
Wear a
Is that one?
mask and
Let me see if it's on here, because I don't see,
I
it
don't
says
see it.
transmitted base. Oh, okay, here it is, right here.
We'll do a better job of organizing.
Yeah.
It's okay, I mean, we're getting it this way, I'm really getting it.
So to make sure that we're using respiratory etiquette, cough, sneeze, you know, vampire, that kind of stuff.
all right.
Don't sneeze through your
Don't
open hands
sneeze,
like
yeah,
that.
Yeah,
All right,
okay.
next.
Healthcare, environmental service technicians play a key role in preventing the spread of infection. They are the front lines of keeping everyone in the
Isn't it
population
the
safe.
patient care?
Would it be this,
Why
why environmental
environment?
service technicians a critical part of?
Yeah.
Oh, we got
the
I've
same
been looking at
thing.
this for- oh, I
Yeah.
didn't know that. That's
Two
definitely,
for one there.
that's definitely the answer to
Why
that
are we an
question.
important part of the
Yeah.
team?
Yes.
As we keep the facility
Why do
safe.
we remember
That's
that?
right. That's what I tell people, like, when we first had the COVID, and everybody was always so big on the nurses, I said, but you guys don't understand, if environment service was not there to keeping this building clean, it wouldn't even be possible for
Yeah.
anybody to enter.
Yep.
That's
That's
right.
true.
You're exactly right.
Yeah.
Wanda?
Okay, to prevent transmission of pathogen spread through direct or indirect contact with individual or surface.
Okay. Surface, so,
She said,
To prevent transmission of pathogens
we,
spread through direct.
the chain. Why do we need to learn about the chain of infections?
so it says transmission of
Oh, it said
pathogens,
transmission.
okay,
Right there.
through direct or indirect contact. Okay, look at the key words there.
Yeah.
Direct or indirect contact with individual surface. So what kind of precaution? Transmission pathogens, transmission based, okay? Contact, what does that tell you?
Why do we use the condition-based precautions?
Why do we use contact precautions? Yeah, we got two of those too.
What's this one?
They're
Why
both the
we
same.
use-
So sometimes when you're thinking about this on the test, if you're confused, try to read the question. Sometimes in the question, it gives you the answer. So this question says, prevent transmission of pathogens. You already know they're talking about transmission based, which is droplet airborne contact. So you already know your answer is gonna be one of those three. When the question says transmission based, okay, prevent transmission of pathogens, you know it's gonna be one of three things. Contact, droplet, airborne. And then it goes on to say through direct or indirect contact with individuals or surfaces, contact precautions, you know? Use the question to get your answer, all right? Okay, only one left here,
Makes sense.
or two? Under
To
one.
protect patients and technicians from transmittable infection agents through the use of PPE, hand hygiene, and assuming all items and surfaces are potentially infected.
Okay, so we're assuming everything is potentially infected, okay?
Potentially infected.
We might not have that one.
Do we have standard precautions on there?
We got,
There we go.
Yeah.
Good now.
There it is. Why do we follow standard
Yeah.
precautions?
why do we follow standard precautions?
Yeah, that's gonna be the one. Okay, that's just assuming everything's contaminated.
Oh.
And then the last one, understanding the chain of infection ensures technicians understand how and where they can break the chain by following the appropriate cleaning processes and procedures. Understanding the chain of infection ensures the technicians understand how and where. Again, look at the question. The question is
Yes, you
understanding.
When you said
chain of
chain, I was like,
Yeah,
here we
there you
go.
go.
So understanding
He said,
it
"Give me the
requires you
answer."
to, why do you need to learn about it? Okay, We need to learn about it so that we can understand how and where we can break it.
Okay.
All right? Okay,
Mhm.
all right. So that was a good little disjointed exercise
Yeah.
there, but we made it work.
Yeah, we made it work.
So those questions are all in your book on page.
Oh, wait, but they-
1.45.
I had to write down the
Right,
answers.
so we're gonna fill them in real quick,
Yep.
all right? So we'll wrap up those cards and pass them over here, and then we're gonna go through these, and you guys write as I talk, okay?
Yeah, and then I'll pass out the card, so in case you wanna write from the card.
Oh, I got it. Okay.
Okay, ready? So the first one, why do we clean? Okay, we clean to remove visible dust, soil, and organic material. You're on
You're
page
45.
1.45.
Yeah, you gotta-
Why do we clean? Is that what yours says, or not?
No, they say, what is the
What
difference
is
It says,
between?
what's the difference between transmission based?
Oh, page, okay, never
Okay.
mind, never
Yeah,
mind.
that's what I was like.
So we weren't supposed to write those down.
Okay, good,
Okay, good, then we didn't miss anything.
okay, good.
Oh, good.
But now they have to write those down.
Yeah, these we're gonna have to write. down.
Okay,
Okay,
we're good.
all right, so.
Wait,
that's
oh, yeah,
yours.
thank you.
You still on the same page?
Yeah, so we're on 1.6 now,
Oh, okay.
1.6 in your book.
4-6, right. Then I'm gonna write it here. That's why he was saying.
Yeah, because things are a little different in the facilitator guide from your guide, so we're kind of flipping back and forth.
Okay.
Okay, so, what is the difference between standard and transmission-based precautions?
That's back on what 5.
So standard precautions are what?
Are airborne and?
Standard, no,
Standard
standard.
is wash your hands, put your gloves on.
Wash your hands, wear your gloves, okay? So we use those for when? When do we use standard?
All the time.
Exactly.
It applies
Standard,
all the
Just
time.
put standard equals all the time, okay? And then transmission-based, okay, are used when?
Precautions.
Yep,
Yeah, for precautions, when there's
Right
something
here.
additional needed. Okay, they're transmission-based. It means you're taking precaution because the patient has something or you have something that could get someone else sick. It can be transmitted, all right? So transmission types of isolation precautions are used in 3 cases: contact, droplet, airborne, all right? How many links are there in the chain of infection?
6.
yep.
Perfect.
Six.
Perfect. Name, you write that in there? Yep. Name 3 things you can do to break the chain of infection.
What you mean, break the chain?
Yeah, any 3 things you can use to break the chain.
Like not wash your hands or something?
Wash your hands, hand hygiene, yeah, there's one. What's another one, Wanda?
I thought it said infection agent?
Hmm?
I don't know,
No, what'd you say?
nothing.
No, you said something.
I said infection agents. You know that they said they change or
Change
infection?
infection, yeah, that's one
Oh,
of
infectious
the,
agents.
one of the
That's
chains.
one of it. How do you break it?
Oh, how you break
Yeah,
it?
this is how you break them.
Disinfect, yeah.
How do you break the chain?
Disinfectant?
Disinfect surfaces, right. What's another way you break chain?
Of the reservoir, right?
Yeah, that's a chain of infection, but this is how you break the chain.
Oh,
Use the
person's
PPE,
PPE, do not come to work if you're sick,
Mhm.
Right,
and, yeah.
Yeah,
disinfect surfaces.
Disinfect surfaces.
Use the right tools. What's any other ways you can break any of the 6 parts of the chain?
yep, the porter of exit is a chain, mode of transmission, and the last one is porter of, well, no, that's porter of exit and then susceptible host.
So how do you break any of those? Name another way to break any of those chains of infection.
So wearing the proper stuff.
Yeah, where people,
Proper PPE, yeah.
Yeah.
Signs.
Wash
And
Read the
hygiene.
door signs.
Yeah.
follow
Read the door
right
signs,
isolation
follow-
precautions. Yeah,
Beware of your
Mhm.
health.
all right, good.
Yeah.
Good. Okay, list 2 common mistakes that can spread infection in a facility. What are 2 ways, mistakes that can be made where things can spread in a facility?
Not wearing your gloves. or
Not wearing your
Yeah.
PPE properly,
Mhm.
yeah.
Not wearing,
something.
If you don't wear them properly, like you wear them
Yeah.
and then you touch something with contaminated gloves.
Mhm.
What's another way that we can spread infection, make a mistake and spread it?
Coming to work sick or something.
Yeah, not covering your sneezes, coming to work sick.
Do not wipe down the hinges and
Yeah,
only dot
not-
area.
Yeah, not wiping things down properly, the high touch surfaces, good.
Not
Those are,
wiping.
those are mistakes that we could make that could lead to spread and infection. Name 3 things we do to prevent the spread of infection.
Use the
disinfect.
PTD?
Use PPE,
Yeah,
What'd you say, Mom?
We disinfect.
Disinfect surfaces, yeah. And what do we talk about a lot here today?
Hygiene.
Top
Yeah.
to
We
bottom,
talked about
back to
clean.
front, what is that called?
Clean.
A cleaning, what? Top to bottom, back to front, high to low, what do we call
Oh,
that?
yeah, wow.
Standard process.
A standard process, you're
Yeah.
using a standard process.
Standard process.
Yeah.
Standard. I'm gonna rewrite
Yeah,
that
standard
down.
process or a,
Standard.
yeah, set process. Okay. What is a pathogen?
It's a germ. It's like,
Could be a germ.
The bacteria?
Bacteria could be a pathogen. Yeah, it's essentially a harmful microorganism.
It's harmful?
Mm-hmm.
Yeah, pathogen is a harmful microorganism.
Okay.
There's other microorganisms that are not pathogens because they're not harmful.
Okay.
All right, how can you be confident that you're removing those MDROs or those methicillin, the drug, multi-drug resistant organisms? How can you be confident that you're removing them when cleaning and disinfecting? So if you have a pathogen or something on a surface, how are you confident that you're removing it?
so please wipe.
Using the proper chemical,
Proper wipes.
using the proper chemical and the proper
Do
procedure.
we say proper chemical or do we use?
Chemical, yeah,
Yeah.
that's what we use. No, proper chemical or disinfectant, either one.
Proper chemical, okay.
Okay. How many times does a chain of infection need to be broken to prevent the spread of infection?
One time it can be broken.
One time, yep, just once. Break any one of those 6 links and you can stop it. Okay, and we flip your page to the next one, and there's a few more of these to review, and then we're gonna be on to the next chapter, and we got module 2, and then we're done for the day. Okay, so name 3 modes of transmission under transmission precautions.
Whatever
So think
isolation.
transmission precautions. What are the 3?
Right over here.
Contact,
Contact, airborne, and
Droplets.
droplets.
okay, yeah, write those down. Airborne, droplet, contact. Those are the 3. Again, we have contact plus, but that is not something that is standard across all industries. But contact, droplet, airborne are standard, or are the approved terminology, I should say. Describe the droplet mode of transmission. So we talk a lot about this. How is the
Sneezing.
droplet?
Yeah.
Through what? Yeah,
Coughing.
through
Through your
mucus,
mouth.
things coming out of your mouth, respiratory secretions, yeah. That's how things
They call
are,
it respiratory.
respiratory secretions. So
What
that
is
could
that?
be mucus membrane contact or respiratory secretions. Yeah, secretions.
Oh, okay.
Secretions. Okay? What non-cleaning techniques can you do to prevent the spread of infection? These are things that don't include wiping of surfaces. What can we do to,
Just to have, definitely keep it, have gloves on.
Yeah.
okay, wear proper glove wear, yeah,
Proper PPE.
yeah. What else? How can we, without cleaning anything, stop spread the spread of
Don't come
infection?
to work sick.
Don't come to work sick, okay? Make sure, and we talked about this as well, make sure, what do we do every single year?
Yeah, right before winter, what do we do?
We get a flu shot.
There we go.
Yeah, get your flu shot, make sure you're not able to
Proper
contact them.
vaccination.
Yeah, exactly. So what PPE should be used for contact precautions?
Contact precautions.
Gloves and
Oh,
gloves.
gowns and
Yeah,
gloves.
Gown and gloves.
gowns and gloves.
Perfect. How can you tell the difference between standard and isolation rooms?
The sign on the door.
It's the signs.
Oh, yeah.
Definitely.
Sign on the door. I mean, Mo mentioned earlier the card outside the room.
Yeah, the yellow
That's
card,
usually a
definitely-
sign,
that's usually the
especially on
first
the
sign.
inpatient areas, but I will tell you, some of the clinics, they either don't have those cards or they have the thing that hooks over the door, the
Oh,
little box on the
Oh.
door. So it's not always the cart, it should be the sign as
Sometimes they
well.
had a chair sit there with this.
Yeah,
Oh,
well, they should
whatever
never
we
have
got,
that.
whatever we got.
Yeah.
Yeah.
They should have that.
They use
should
the
have sign.
handrail.
Yeah.
They should have the signs and it should be in the right place, so I know sometimes they go rogue out there.
Mm-hmm.
They don't have it down
Alright,
there.
but the door sign should tell you which rooms are isolation and what precautions should be taken. So name 3 parts of the cleaning process, the standard process that we use. How do we clean?
Surface,
What's that?
surface.
She says surface.
No, not quite. How do we do it? How do we
it?
clean?
What's the
When you go into the
process?
room, how do you clean?
Pull trash.
All
out.
7
Disinfecting.
You use 7 steps.
Yeah, but
Right,
what
but
do you
what
do?
is, what does the 7 steps force you to do? Go which way?
top to
Disinfecting.
down,
Top to
top
bottom.
to
Top to
bottom,
Down,
Yeah,
yep.
top to
clean to
bottom.
dirty,
Clean to dirty,
Yep.
and
Clockwise.
clockwise or counterclockwise.
Yep.
And
And then right
then
over here, if you
we're
need to
gonna
write
wipe-
them down.
Where?
Right
cleaning
there,
process.
process.
That clean, dirty, top to
Yeah.
bottom.
Clean to dirty, you
Yeah, I would write those down because those are ones that keep coming up and they're gonna keep coming up over the next few days.
Top to bottom, clean
Clockwise
to
or
dirty.
And
counterclockwise,
wipe in a right direction.
one direction.
One direction.
One, that's a one direction.
Yep, one direction.
Okay. That, my friends, takes us to the end of infection control.
Woo-hoo.
That is the longest of the sessions, so thank you for bearing with us through it. It's supposed to come out at about 4 hours, and it came out a little longer than that, but figure we had lunch in there too, so. And then I had you fill out the pre-work ahead of time too, so that took a couple minutes. So we're about on cue. I'm gonna give you a 5-minute break right now, a little restroom break. Get some water, whatever you need. We'll be back here at,
Oh, this over at
2:08.
3 o'clock though?
Just about.
so like 11 or 12 after, okay, 5-minute break, back at like 11 or 12 after, 13 after. And then we will jump into our second session, all right? And this will take us just about an hour and something, a little over an hour, but we'll get you done by 3, hopefully. That's the plan.
Must not be nothing back here. That's why we did that.
On the
That's it.
Wi-Fi?
Yeah.
Oh, yeah. Yeah, he just wanted some number. Yeah, I told him it fluctuates. I said, we have one this many one this week, next week it'll be different.
So we're gonna give more. Yes, thank you. That whole back to front. Yeah, yes.
Okay.
Just waiting on Wanda.
Yeah. So this next section for you guys starts on 2.1, I believe.
Yes.
Yes, 2.1,
Yeah.
this is assignment supervisor and other staff. Oh my God.
So the good thing is we don't have to discuss the previous session because we just ended it.
Mhm.
So that,
So
Yes,
that should
if
be
you-
good.
It saves us a couple minutes.
yeah, it saves us some time.
All right, yeah, we can motor through this.
Yeah.
Okay.
I think. This has got some scenarios at the end.
Mhm.
Kind of talks through a lot of customer service stuff, understanding how to stay safe, identifying how you will keep patients safe.
Yeah.
Recognizing key principles of infection prevention and control, recognizing your critical role in infection prevention as part of the patient care team, and discuss particular challenges of working in healthcare. Okay, so I do need one video that I'm gonna have ready for this. And that's gonna be a video. Okay. Back to our slideshow. And we're gonna be in module 2. Okay, So module 2, they again want us to go back and remember what we learned in module 1, but we've already done that. So we can move on to module 2, which is assignments with supervisor and other staff. So, all right, so the knowledge you've learned previously is used again in future sessions. Just know that we're gonna keep coming back to a lot of this stuff. And again, the repetition is important because if you hear us repeating the same things 3 and 4 and 5 and 700 times, those are likely things that we're gonna be seeing.
Yeah,
on the exam.
I've been putting big X's, so I know.
Okay. So assuming module 1 was covered, again, we did all the review, so we don't have to go back through that. So now that you know the why we do certain things with infection prevention and cleaning, it's time to start on daily rounds. Okay, think of this as a morning, a day in the life. Okay, the rest of the sessions, beginning this one, we'll walk you through a day in the life of a healthcare environmental service technician. Imagine this is your facility. Today we start with basic interactions with your team. Okay, explain the session. We're going to explain the session is about common ways that you interact with supervisors and other coworkers while receiving daily assignments. Also includes information on emergencies that might happen in the facility. Okay, this is meant to be an open discussion, so please feel free to participate. And if you have, if you have any questions before we start. Okay. Yeah. Okay. So we're gonna watch a short video that shows a supervisor and an ES team interacting with each other. Pay attention to the way they communicate and solve problems. Okay. And then we're gonna watch this quick video. We all ready? Think, wait, hang on. No, it's down here. And video.
Good morning, team.
Good morning. Good morning.
I hope everybody had a great weekend.
Yes, we did. Yeah.
Before we begin our meeting, I wanted to let you know that we have some staffing challenges and we might need to prioritize a little bit. As you might have heard, the results for the most recent HCAP survey came out last week. Overall, our department received very positive feedback, but it looks like we've had some complaints of trash being left out in the surgery center waiting room. I was hoping you could help me come up with a plan to help out. I know that you're the professionals when it comes to cleaning.
Well, I usually wait and clean the waiting room until the end of my shift when it isn't so busy. I could always try and clean it earlier, but I'm not sure if that'll help with the trash.
You know, I usually pass by the waiting room on my way to some of my patient rooms. I could pick up and empty the trash throughout the day if that would help you out. It won't put me behind.
Yeah, that'd be nice.
Yeah. Thank you, that would help a lot.
Oh, no problem.
I can still be responsible for cleaning the waiting room at the end of my shift. If you could help with the trash from time to time, that would be great.
Greg, I think that should keep the trash from overflowing. Thanks for offering that solution. Teamwork goes a long way in this department. With that taken care of, let's talk about the rest of the plan for today.
Okay, so again, a quick little snippet, quick little vignette about that particular group and how they are handling their business and how they talk. Certainly a much smaller group than we would have in a huddle, and probably a much more specific concern that they're dealing with a specific issue. We may not bring things like that to our large group because there'd be 27 different ideas on how to handle something, but sometimes we do. I mean, things that have come up lately in terms of our huddle are things like, the carts being left a mess all the time, and those are things where I'm going to keep tasking the individuals with helping to fix that because I can't, nor can any manager, go around and check every single cart at the end of the day. If they could, we'd have to have everyone bringing their carts down at the end of the day, and we don't want to do that. So we've got to find ways to, number one, get at least a spot checking process in place, but kind of put some of the responsibility back on the people that are using the carts and doing the job. So that's an example maybe of how we'd have similar dialogue with our group. Okay, so I think their huddle showed good communication amongst the team and was really designed on finding a solution. Okay, that's one thing to remember. When we have these meetings, the end goal should always be, let's find a solution, not just, bitch and moan about a problem. We all got problems. We all got things that happen in the course of our day or things that, all we do is keep complaining about them and no one steps up to figure out a solution or an answer to how we can fix it, then it's always on 1 or 2 or 3 people to fix every problem, and that's impossible to do. Okay, so, I always try to make sure if I'm going into my boss or going into a group meeting with a problem, that I always already have 2 or 3 different solutions in mind. So you guys are the experts, you guys are the ones that are out there doing the work every day. If you can think of a solution to go along with the problem, it just makes it that much more productive a session. And I think those folks kind of showed how you step up right away and say, well, here's the problem, I know the problem and here's why, and I'm gonna try and do this and this might help, okay? You notice they talked about the issue of prioritizing because of staffing issues, See, it sounds like, everyone's got some of the same issues that go on out there. And we always try to present things here as the patients are always gonna be first. We're always making every decision based on the patients being the center of what we do. And then the other things we can figure out, if we're short-staffed and we've got to pull someone from a research building or Carlton House or somewhere where there's a bunch of offices, I'm always gonna err on taking care of that patient first and then worry about the offices later. All right. Not that we don't care about our internal customers, but our patients are our most important. Okay. So what do you think? Let's think about maybe like a sports huddle, like a football team that gets together before a game and has a little huddle. And the players kind of get together to discuss, what they're going to do. What do you think the mood is? What do you think? How do you think they're feeling in that huddle?
Hyped.
But yeah, hyped probably. That's probably one way they're feeling. Maybe a little nervous.
A little nervous.
Maybe a little anxious to get started.
To get it on.
Maybe like I feel like I'm prepared, but I don't know what curveballs are gonna come at me this day or this game. A lot of the same feelings we feel at the start of each day. What's my day gonna be like? What's gonna happen? How many discharges am I gonna have? What how's my cart gonna look when I get up there? What is nurse so-and-so that I don't really necessarily get along great with gonna be here today? All those questions kind of run through our mind, okay? And preparing for, again, solutions and answers for some of these things can make our day a lot smoother. All right. Are there things that happen in our current huddle that you think could help things run more smoothly? And I'm asking for honesty here. I don't need, I don't need you to stroke us. Like if there's things we can do to improve our huddles and make them nicer or better or more effective.
Well, they are pretty effective, but could they be faster?
So shorter, you mean?
Shorter?
They could be. I think so. Yeah. I mean, we have to cut some stuff out. I think sometimes they are short and sometimes they aren't.
But just sometimes people that they might not work that day and they miss some that's important.
Yeah, especially if we want them to hear it.
Maybe we want them to hear it, and they're not there, and then, so they don't know.
Okay. So you're saying find a way to make up the information or get the information to people that aren't there?
People that ain't there, and sometimes they need to know it and they don't be there.
Okay, well, that's a good point. I mean, a lot of times we'll post the information in the office, but there's a lot of information posted in the office. So to be able to fish through all that is kind of tedious, and to find that one thing that you didn't hear. So, yeah, let me take those things back and look and see how we can make that a thing, make it.
I mean, like you can take the piece of it, say the method of the week. Can't you just take it? I mean, can't you put it on a board to where we can just take it and read it ourselves?
Yeah.
That's what I used to do at Weinberg when they did it.
Definitely.
And we used to just take it and read it.
That's a great idea. It really is. Okay. What do you think a well-run huddle can do? What do you think? How do you think it can be very effective? What do you think the benefits of having a weekly huddle are?
It's supposed to give us positive, and we're supposed to get feedback.
Right. It gives you information. I mean, in my opinion, it gives you information on what's going on around here, so you're not blindsided. I'll tell you that there are other departments that when they hear the huddle that we do, will be like, man, you guys really share a lot of information with your team and get a lot of information out to your team. And a lot of times we know about things, or there's been times when we've started doing things that we were asked to do, and then they're like, where nursing has been like, well, why are you doing that?
Yeah, with the goggles, remember?
With the goggles,
Yeah, remember that?
Because we followed instructions and we got it out to huddle and everybody knew what they were supposed to do. But nursing hadn't even talked to any of their folks first.
No, that's the first thing the girl told me.
Yeah.
Like, why you got those on?
Yep.
Our huddle can be very effective because we can get a lot of information out very quickly to a group of people versus having to get onesies and twosies here and there, So, okay. All right. Okay, so we're gonna go through a situation here. And in this situation, the supervisor that we're dealing with is gonna train the group on an important topic, emergency management and the Hicks model. So Hicks model is the hospital incident command center model. Okay, so in our scenario that we're going through today, this supervisor, this mythical supervisor, is gonna be working to train the staff on the Hicks model. Now, we have actually used the Hicks model here at Roswell during COVID. It's called the Hospital Incident Command System. So if you remember, all throughout COVID, when we were having our daily huddles, I was saying, updating you with information from Incident Command. And what happens at that point is the president of the hospital is not really the president of the hospital. The incident commander is in charge of everything that is happening. Okay, so when we came to you and said, this is from Incident Command, that's what we were running this emergency scenario. They're really designed to set up and run for, a small period of time to deal with a certain issue, whether that's a mass casualty, whether that's something that happens out in the, Lord forbid, a shooting or something like that, where you have mass casualties coming in, or a power outage or a snowstorm. And they're designed to the system's designed to handle like a few days or a week or even a month. It's not really designed to go 2 years. But for COVID, we went almost 2 years under incident command. So that's what the Hicks is. All right, so can you think about a time you've been in a grocery store and you hear a page come over the intercom, someone says like clean up in aisle 10?
Yeah, I seen that.
Do you go running to aisle 10 or do you immediately just like not go anywhere near aisle 10?
I go nowhere near aisle 10.
Right, because you think you're gonna be like, you're gonna
Fall,
slip and fall, there's a problem, right? So what do you think you would do if the intercom was used to inform you to exit the grocery store immediately?
I leave. I'm out.
Yeah,
I've done it.
yeah. Do you think you respond the same way as you would to the cleanup in aisle 10, or do you pay less attention to the cleanup in aisle 10 if you heard get out immediately, that like light bulbs would go off?
Yeah, the way stuff happening now, it's like.
Yeah, I leave. I listen and go.
Yeah, but you probably don't even think about or hear half of the things that come over the intercom at a grocery store or even at a hospital. There's
I
a lot
do
of
because I
noise.
sing the songs.
Yeah.
I'm in the grocery store singing along with the.
Oh, with the intercom, with the music?
Yeah, so
Yeah.
that's how I get my groceries done real quick.
Okay, so one of the things we do have to be aware of is intercom noise, okay? And kind of that white noise that it becomes where we hear things kind of subconsciously, but we don't even realize like what's going on. So if we hear, a rapid response, how many of those do we hear a day, So many that it doesn't always even register with us.
Yeah.
Because we're not really part of the code response team. So what codes could you possibly hear here that would apply to you?
Code red.
Code red, which means,
Fire.
right. And what is your response in a fire situation?
I just go stand by the door.
I don't know, what,
Evacuate.
So there's a couple things we do in the event of. a
Well,
fire.
I help them move the carts out of the floor.
Exactly.
So I
First thing
make
we
sure
do
it's
is get
clear.
our cart put away, get
Yes.
our cart and
Oh,
our
yeah.
that's when
equipment.
they start moving stuff.
Out of the
around.
hall.
Yeah, I help them.
Okay,
So
and
I
we can
move my
certainly
cart.
assist nursing with anything they need help with.
Yeah.
Make sure all the doors are closed in your area, they're closed anyway typically. Make sure all the doors are closed, make sure our cart is put away, and then we listen for further instructions from that unit. We don't go running and screaming from the building's on fire and, run out to the parking lot. We await further instructions.
And if we heard a code purple, do we still do the same thing? That means it's a person, what's the name in the building?
Dangerous person.
Yeah.
Person? Yeah, I mean, typically for a dangerous person, they're gonna announce where the person is.
They're not gonna announce it over. I think though, they do the text messages,
They
right?
do the text messages or send it to your phone, because they
Yeah,
don't
yeah,
wanna
cause I
get
got
them.
it from my.
They don't
phone
wanna key
before.
them into the fact that they
we
might
know
call
where
a
they
code
are.
purple, but they're not gonna tell you the instructions
Yeah.
of where they are. They have, everyone who's works here has an emergency contact number
Yeah.
that's put into Roswell's system. And if there's some emergency of that nature, they're gonna put the notice over text, because they don't want the would-be shooter or dangerous person to like understand that they're being announced where they're at. It might
Okay.
cause them to do more harm more quickly or things like that. So definitely a code red definitely applies to us, okay? Other things that,
Code pink possibly.
yeah, so let's do a flip chart here under things that are codes that apply to us and ones that don't apply to us.
Okay.
We should be on page In your book, 2.6. Yeah, so the first one is, what are some codes that don't apply to you? I just mentioned one,
Oh, yeah, we just said code blue.
like rapid response. Rapid response in code blue does not apply to us. And basically, what we should do in those cases is get the heck out of the way.
Yeah, go to white.
Yeah, code white, yeah, code white is typically, I mean, it should all be on here, the ones that we follow.
You said
Yeah.
rapid? We don't-
Yeah, I mean, rapid, we just get the heck out of the way. You know, that's really all we do with those, because we don't want to have a floor machine or have, be moving a bed or something and have it in the middle of the hallway so that people coming through with a crash cart can't get there. All right? Code red would apply to us, so that would go under ones that absolutely do apply to us. And we talked a little bit about what we would do.
We're right, okay.
So the first question is what don't, and the second one is which do. So the ones that don't would be things like code blue, rapid response, code white is more
Possibly.
the emergency operations plan,
But-
possibly.
Yeah.
But sometimes we're asked to help with
Yeah, if
certain things.
it's like a weather,
Yeah.
like if it's snow, we might be asked to do some
Yeah,
shoveling with cold white.
yeah. Code purple, again, it's dangerous person. Really, we've talked about and had guest speakers come and tell us what our responsibility is. It is basically, what do they say? Run, hide, or fight,
Yeah.
right? Isn't that the
Yeah.
theme? So you run if you can get away,
Yep.
you hide if you can't get away and barricade yourself. And then worst case, if you're face to face with the would-be attacker or the dangerous person, you fight as though your life depended on it, because it probably does. You throw chairs, you throw tables, you take your mop handle and smack them with it, whatever you gotta do. And don't play around with your life, because they ain't gonna play around with you. Code pink could be a missing or abducted person. All right, that's definitely something that could apply to us. And what do we do in the event of a code pink? Missing or abducted person. Do we conduct a full search of the area? No.
Would they call a code pink if a patient just walked outside? Because I know the other day a patient on our floor went outside and they couldn't find him for a second. He was just, he was ready to go home, but he just walked outside. He wasn't hooked up to nothing. So what do they call for that? 'Cause I
A
wasn't-
missing person or an abducted person would be a code pink. And our role really in that is to just kind of take a second and stop and observe, okay? Observe what's going on around us. Look and see if you see somebody that looks suspicious with like maybe a bundle of blankets under their arm or something like that. Could be, we don't have a lot of infants or children in this hospital. We do have a PEDS unit though, so that could happen, but it's not always a child that's abducted. It can be. Or look for someone who's like running real hurriedly to a stairwell to try to get out of the building. Those kind of things are typically what we look for in the event of code pink. And just be prepared to report what you saw and when. You don't have to chase the person or chase them down or anything. All right. Okay, there are no national standard colors for codes. Okay, but we just reviewed some of the ones that apply here. Talk about that. Okay, the HICS, or the Hospital Incident Command System. So think back to a time when you were in school and you participated in a fire drill. You think this drill was planned or unplanned?
It was planned.
Usually they're planned. Sometimes they're unplanned if someone pulls the alarm.
Right.
Or if there's an actual fire, but usually they plan them, okay? They rely on internal, external resources, such as the principals, teachers, and fire department in a school. Everyone has an assigned role. This is very similar to the HICS, or Hospital Incident Command System, which assists us for planned and unplanned events. Okay, so again, Hospital Incident Command System, write that down in your book on 2.7. HICS, Hospital Incident Command System. Okay, so you play a role in HICS by providing support and assistance wherever needed. Becky talked about pushing everything out of the hallways, making sure all the doors are closed, okay? So that would be in a fire drill. Those would be the primary things we would do in a fire drill. You can write those down. Did you do hospital? Oh, you did it here. Okay, you can do it either way. So the second question, you play a role in Hicks, okay? But what would you do in a fire drill? Move everything out of the hallway?
Everything out of the hallway,
Yeah.
and I stand at the
Make sure-
exit door.
Yeah, make sure that the doors are all closed
Make sure.
in your area, including your opera room door, housekeeping closet door. Okay, and then await further instructions. You do not go running from the building, and if you are ever asked to evacuate, make sure you check in with the manager before you leave the property. Okay, in the event of a tornado, what do you think our role would be?
I never knew.
Because we really don't have them here. But if there was a tornado, it'd be more like, probably more support, facility support for mass casualties coming in. So let's say there were hundreds and hundreds of patients that had to be placed. And Roswell, being a specialty hospital, doesn't typically take patients from the community. But if we were told by the State Department of Health or Erie County Department of Health, you have to take acute care regular patients, we essentially would probably help with setting up of chairs and
Yeah.
tables for triage and things like that. That would more be our role in the event of a tornado or a natural, really tornado, earthquake, any of those natural disasters. They have pandemic listed here. What would be our role in the event of a pandemic? Well, we just went through it. What was our role?
Yeah.
What's the answer? What was our role during the pandemic? What did we do?
You just came to work with masks on.
We changed our PPE a little bit, yeah,
All the
based
time.
on the directives. What else did we do in the
We
pandemic?
did a temperature change, we had to do all that.
Yeah. What about our actual work, our job? What, anything changed with that?
Disinfected, nothing changed. We did the
Well,
same
other things
that
that
we always
changed, so our technique didn't
did.
change,
Yeah.
some of our chemicals changed, so we went
Yeah, we
to.
went from 456
Yeah.
to peroxide.
Yeah, well, and in a lot of areas, we went from the peroxide to 456, because we were running out of the
Oh,
peroxide.
yeah, for a minute.
We kept,
yeah,
we kept the peroxide for hospital only,
Only, right.
and we pulled the 456 out of all the clinic, or we went to 456 in most of the outside buildings and clinics. The other thing we did, Felicia and I worked to get our yellow peroxide cleaner, we essentially converted that to a higher level of peroxide. So that gave us a third chemical to use against COVID. So those are some things that we did as a department. We also set up as a department a station to hand out scrubs.
Oh,
If you
okay.
remember, that station that we had, that we were all manning downstairs in the lobby to hand out scrubs.
Oh,
That was
yeah.
something we were asked to do during the
And
pandemic
they
to
did
assist.
do extra cleaning,
Yeah.
people did do.
We did a lot of extra cleaning with office spaces where someone had gone home sick with COVID, and we'd go and disinfect
Our
the whole
public
office.
spaces, extra clean.
Yeah, extra cleaning the public spaces, which we're still doing right now. So yeah, we did a lot of things during the pandemic. And then workplace finance active shooter, we already talked about that, run, hide, fight. Okay,
Supplies, and I just forgot one more, supplies and I think it was something else.
Which one?
Supplies and setup.
Oh, yeah. Tenant, we might be asked for extra supplies, help with setup, cleanups too.
Oh, cleanups too? Okay,
Yeah, with,
sure.
yeah, if it's a big tornado, like, remember,
Mhm.
well, what did we have? Remember, when was that? A couple years ago in the park
Yeah,
for
what was
Employee
that?
Appreciation Day?
yeah,
Yeah, we did have
Mhm.
something.
yeah,
Yeah.
some touchdown.
And then we had to
We
clean
didn't know
up.
what it was.
Yeah, it was,
Yeah, it was on, yeah.
yeah.
So hospital incident command system. Okay, next. Okay, explain a time when you heard, talk about a time when you heard a neighbor or a friend sending their child to daycare or school with a slight fever, hoping that no one would notice, but then an hour later, that friend got the call to come pick up the child. And we've had that here, where people say, oh, something the kid, we thought they'd be okay, and then they got called right away to come pick up the kid. Okay, why is it important that children avoid daycare or school when they have even a small fever?
Because they can pass it on.
Right, and get other kids sick, right? Okay. Any other reasons? Okay, so, the same could happen here, obviously. You saw the consequences when we saw this young lady sneezing through her hand, the possibility that she could be sneezing and spreading things throughout the facility. All right, so we are very clear and we're very, I think, specific and direct about the fact when someone comes to us and says they have symptoms of anything, they feel sick, they're acting sick, they look sick, they sound sick, we send them to employee health. Go to employee health, get checked out. If they call us and say, we checked them out, they're fine, they can return to work, then nothing ventured, nothing gained. But if we don't do that and the person turns out to be sick and we allow them to continue to be here working, chances are they're gonna get a patient sick, they're gonna get a nurse sick, they're gonna get a fellow employee sick. And then we're worse off than we were to start with, you know? So, yeah, I mean, think of the way we come in contact with patients and other people at work. I mean, we come into contact with, you know, patients in the patient rooms, in the waiting rooms, in the lobby, helping them get on their way to wherever
You
they're
know
trying to
what
go.
bothers me is the person, say that the staff, one of us, came in with a respiratory problem. And they passed it on, even though they were clear to come back to work because they got antibiotics, but they're still coughing.
Right.
Oh.
Well, I mean, we have to err on the side of medical direction. We can't like tell people, well, I know your doctor's note said you could come back, but we're not letting you. We err on the side of what the doctors say.
Okay.
So if the
All right.
doctors say they're not, now, we may, if we feel strongly enough and they're back at work and they're hacking all over the place, we may send them back to employee health and say, listen, we don't feel comfortable with this person here. They're gonna get everybody sick, you know, check them out. So we will and can do that. And infection control really is pretty, I don't wanna say liberal, but they're pretty quick to send people home because they don't want people here that are sick. So they're not ones that are like, oh, yeah, go back to work, you're fine. They're gonna send you packing. All right. Okay.
We have the question in their book to answer.
Yeah.
How do we
Yeah.
come in?
Okay, yeah, what are ways that healthcare environmental services workers come in contact with patients and other staff members? How do you come in contact with patients? And other staff members?
What ways that we
Yeah,
come in
Yeah, how do
contact?
you come in contact with them?
We're going in the room.
Sure,
Yeah.
okay, going in patient rooms with direct contact with patients. What are some other ways that we indirectly contact with people?
Touching doorknobs and
Touching stuff,
handles and
yeah,
turning the lights on.
touching things with our grubby hands,
Yeah.
yeah. What else? Any other things that we do in and around areas that we, you know, could spread infection?
Talking.
Talking, you know,
Yeah.
knocking masks on.
Without your mask on.
One thing we talked about with airborne isolations that we do before we come out of the room. That if we,
Gloves.
right, but there was one specific thing that we do, that if we don't do it, it could contaminate the next room we go to.
Yeah.
Wash
we
your
gotta
hands.
wash
You said
our
the same
hands.
gloves.
Right, but what else do we wash? What else do we wipe down before we take it into
Well,
the?
All
wash
the
your-
equipment.
All the equipment, right, so our equipment goes room to room, so that's potential to, again, pass things around. Okay, so,
Disinfect, that's what you mean?
yeah,
Before-
so ways we come in contact with another, patients or coworkers or other staff members are just what we have up there, direct contact, either by going into the patient rooms, the equipment we might bring in and out of the room, touching handles and door handles and break rooms and things like
Right,
that,
elevator buttons also.
elevator
Oh,
buttons.
okay, elevator
Yeah, those
buttons.
are all things we touch that another staff member might touch, and now we've essentially come in contact with them indirectly through the elevator
And
button.
that's one
That's what
reason
you
why
mean
you're
by
not supposed to wear
indirect.
gloves, you know, walking around the hospital.
Or
Say
in
you
the
got
elevator.
something, yeah, exactly. Say if you have something on your glove, you go to push that elevator button.
Yeah.
Now, the next person doesn't have on gloves, touch it. Yep.
You know what someone told me? They said, well, I just put the glove on.
No,
I didn't
no
know what
matter.
to say.
Nope, it's not. That's against infection and control policy. That's actually policy for infection control. You can't walk around with gloves
I
on.
said that.
Yep. You were right.
Okay, so go to 2.8 on the user guide, you should be there,
Mhm.
okay? And we've got a picture on the screen of Megan here,
Mhm.
okay? You heard Megan cough a few times today, she's starting to look a little sicker as the day goes on. And then you strongly suggest she goes home, she claims she's fine, she wants to stay and finish her shift. Megan leaves to go clean an isolation room, and a new patient is coming into that room shortly, what do? She's going to clean a discharge in an isolation room, and then a new patient is coming into that room when she gets done. What do you do in that case?
Maurice, what would you do?
You clean the room.
I mean,
You disinfect.
But Megan's going to clean it.
Megan going to clean it though. What, did you tell her don't clean it and let
She had
somebody
to,
else
she
clean it
had
or
to be
what?
used all, whatever they had to use, that.
You think
Ah.
someone, what's the first, if you think somebody doing something wrong, what would you do first? What's the first thing you would do?
Tell them.
I'll tell them or
Yeah, who would you tell?
supervisor.
Yeah,
Yeah,
you report it,
So
right?
you tell on them? I mean.
Yeah, cause that's what we trying not to
You know,
do. Because we say that about Dorothy, I'm sorry, but we do use her as our example.
Mhm.
And we always say she tells everything, so,
Right.
I mean, we know
But
it's
it's
a
her
good
passion
thing.
for wanting to get things done the right way. So I would say, your first step usually would be to tell the person, hey, you know what, you're sick, you really shouldn't be cleaning that isolation room, because if you're hacking all over it, it's probably not gonna be clean when you're done, And then they're gonna put another patient in there and risk getting them sick. So one thing you could do is talk to Megan and say,
It's my
Megan,
allergies.
Megan, what's going on?
I'm telling you, it's my allergies.
Right.
What if what if your daughter was going in that room? What would you do? Would you just let her go in that room? She's gonna be a patient in that room? You gotta think of it like that, though. You gotta think of it like that.
Because it is someone's family member going into that room,
But tell
So-
another staff member it might cause a problem.
Yeah, but you
Yeah,
don't
that's
feel
gonna
comfortable
cause
telling
I
a
would
staff.
say you start by talking to the individual and tell them, listen, it's probably not a great idea for you. to
Unless you
clean
say you gonna
isolation.
do it, then they might, if you be like, yo, no, I'm gonna do this.
If you have time and you can do it, that's probably a better option. And then finally, if you've exhausted that, tell your supervisor.
Yeah.
You know what, I just don't feel right about this. Our patients are gonna get sick, If you can save a patient from getting sick, then, you know what, if their nose is a little out of joint, that's too bad. They shouldn't be here working sick, Okay, so you can jot some of those notes down on what you would do next, but I think there's a few things you could do. We just talked about some of them. You could go to the Megan and say, hey, don't do that. You're gonna make the next person sick. You can go to your supervisor. You can offer to do it yourself if you have time. All those are potential options. Okay, so we know our priorities can change throughout the workday. Patients are moved, transferred, spills, we short of supplies, patients have questions, nurses need our assistance. Okay, it's not only important to communicate priorities and information, but also to be able to quickly prioritize your tasks. Okay, so how do you decide what to do next or what to do first? Okay, so as you're working through your day, how do you decide what to do next?
Cause they go to the next room. Mine's is a pattern. I got a
Okay.
pattern.
All right, so you have a pattern. All right, so follow a pattern. What are some other ways to figure out what to do next?
For me, a lot of times I have to wait for patients leave, so I don't have much of a choice in certain areas I can't get in. Especially if they're doing a biopsy, I just have to wait until.
Okay, yeah, so you can work on your area based on the flow and based on what patients are there. Okay, that makes sense. What else? How else do you decide what to do next? Let's say you're on a patient floor and you got 4 discharges to do and you're the only one doing them. How do you decide which one to do first?
I do the hardest one.
Supervisor, which room they need, you ask the nurse which one they need.
That's a good idea. Which one do you need first?
I usually,
If that one that you're doing first isn't gonna have a patient put in it till the next day,
Yeah.
but the other 3, the patients are sitting down in ATC waiting, then, prioritize
Last
it.
week.
I just realized that patients be downstairs waiting on us to get the
I didn't know
rooms
that
clean. A lot of
either.
people don't know that.
I just found it out because it's so busy now.
Yeah,
So,
very busy. There's typically
Yeah, they be waiting.
2
for
places
rooms to
usually.
open up.
Usually 2 places they're waiting for. They're either waiting in ATC or they're waiting in PACU.
Yeah.
Those 2 places where they're pushing patients up to the floor. Okay. All right, so we're gonna go through some scenarios. You're gonna be on 2.9 to 2.11, okay? And we're gonna have the rest of their time, we're gonna go through this and then we're gonna review this section, then we're gonna get the heck out of here. So, let's talk through these different scenarios. Okay, first one is you're starting out your day with a list of rooms to clean. Which should you clean first, an occupied room or an unoccupied room?
Occupied room because it could be needed right away, because it's a
Think about it.
priority.
What did you say, which kind of room?
Occupied.
Oh,
Unoccupied.
Unoccupied.
Yeah, somebody might be waiting on that.
yeah,
room.
wait, so that's our priority?
You're gonna clean an unoccupied room, meaning a discharge or a transfer room, because they could be waiting to send somebody up there. Okay, but again, checking with the nursing soup is always a good, or the charge nurse is always a good rule of thumb.
Yeah.
But typically unoccupied rooms are the ones that should be done first, okay? If there's several rooms that might delay cleaning all the occupied rooms, then this information is related to the supervisor. Let your supervisor know, hey, I got 3 discharges I'm walking into. I'm gonna be behind on my trash or whatever, so we can get you help. All right. Number 2, You're performing a general cleaning in room 2 and you're planning to move to room 3 to complete the cleaning there. Room 3 is unoccupied. Nurse Jones just informed you that the patient in room 4 is expecting family visitors in 2 hours and wants you to clean her room next. What do?
You just clean the room next.
We got an
Possibly.
unoccupied room
But they might not need it.
It's not
They say they-
priority.
How do you know if they don't need it?
Well, because they asked you, they asked you to do the other thing first.
Oh, Nurse Jones asked you to do it. Is Nurse Jones in
Yeah,
charge?
she's not in charge.
Supervisor.
She might be, but maybe she's not. So I guess the main thing to remember in these kind of scenarios is gather more information.
Okay.
You know,
See
ask the
what's needed
questions.
first.
Yeah.
Hey, you know what? I got this. Hey, Nurse Jones, I got this, or whoever the charge nurse is. I got this room 4
Yeah.
that's unoccupied. I'm gonna do it. Or I'm sorry, room 3 is unoccupied. I usually would do that next. However, I'm getting a request to do room 2. What would you recommend I do first? And they might say, oh, nobody's going into that room 4 until after lunch. So, you know, they're down in surgery now and they got recovery and they're not gonna be up there till 2 o'clock. Take care of the family members coming in. But again, ask questions, all right?
Let's see what's the plan.
Because it could go either way. The other thing you can do though is you can let the patient know in room 4, since they've specifically sent the nurse looking for you,
Yeah.
stop and talk to the patient
Yeah.
and say, hey, you know what? This is what's going on. I talked to the charge nurse. We have someone waiting to come to this room. I've got to get it cleaned first and then I'll be right over. Just to set their expectations so they're not anxious and wondering what's happening. The third one, ER is planning on sending up 2 new patients, stat. You weren't, so in our case, this would be say ATC. You weren't planning on cleaning the unoccupied rooms until the end of the shift and you were on your way to clean the common area. What do?
Go immediately.
Yeah, go immediately. I mean, patient rooms are always a stat. They're always the most important. So patient rooms are the priority. You can, if you think it's gonna put you behind on some of those common areas, let your supervisor know so we can juggle some things up and get you help with your centers. All right? But don't just blow off the patient room and say, I gotta go clean these public areas. It's my time to do it. Okay?
Mhm.
Okay, your coworker John is slammed. He asked for your immediate help cleaning a specialty area as you're on your way to clean room 6, which is occupied. An elderly patient is in room 6 and you told her you'd be in a room to clean in the next 30 minutes. You know John's request will take more than 30 minutes. What do? You want to help John because he's slammed, but you had already promised the patient that you'd be there in 30 minutes. So what do?
You can go back and tell the patient you might be a little longer than 30 minutes because you got something else to do.
Okay,
I mean,
Explain to the
yeah,
person.
explain that.
what's the first thing you should do? Because you're going to help John in an area that's not your area of responsibility.
Yeah, I'm gonna call my supervisor. I'm tired. I'm gonna call her.
Bingo. Call your supervisor, let him know you're leaving your work area to go help. We appreciate you doing it, but we also need to know it's happening.
Mhm.
And your supervisor might tell you to clean a patient room and they'll send someone else.
She might
Right,
Right.
right.
They may say, you know what, I've got so-and-so over here that's, thanks for the offer, Mo, but I got Wanda here and she's free and clear, just looking for something to do. I'm gonna send her up to help John.
Mhm.
Okay. You have 15 minutes until the end of your shift, which is just enough time to clean up a spill in the common area. Nurse Smith ran into you in the hallway on your way to your common area and let you know the patient in room 1 has a question. What do you do next? So now you're torn between a spill that you were called for and a patient that wants to talk to you, that has a question. What do?
I'm going to the spill. I'm going to the spill.
So you're going to the spill first?
Yes, I'm going to the spill first. I talked to her in a minute. This is all she wanna do is talk.
I mean, it depends what they got. I mean, if it's something serious, I guess.
Yeah.
Okay.
You know, so, you know what's going on. But I mean, it can't be nothing too serious. They come in, I mean, they would ask the nurse or something they need.
Right.
Right. The other important thing to note in this scenario is that you have 15 minutes before the end of your shift, okay? We are not, and I've told people this before in huddles and whatever, we are never going to begrudge you a few extra minutes to finish up either cleaning up a spill or talking with a patient. So if you come down 15 minutes late and clock out, you're getting paid for that time. I have no issue, and I'm happy that you took the initiative to get both of those things done, because now someone's not gonna slip and fall on the spill, and the patient is happy that you talked to them. So from our perspective, you can always have that conversation. You can always say thanks to the patient and get them settled and get the spill cleaned up. But I like the fact that all of your first inclination was take care of the spill. Like, that's a safety issue. That's something that, the patient could. And you could also inquire from Nurse Smith, was there something specific? Is there something that if the patient needs me right away, or they just want to know who to, start as their fantasy football quarterback? I mean, it's determining what the priority is, is the big thing.
I had that
But the
today.
spill
so
is
I know what
always-
you're saying.
Yeah, the spill is always gonna be, the safety issue is always gonna be the priority, all right? Okay, you left room 6 to clean a discharge room because a patient is being admitted in 2 hours. A patient in room 3 has an issue with the way the bathroom is cleaned. What do you do next? So do you go back and finish 6, or do you go talk to the patient with the bathroom issue?
I'll go to the patient bathroom.
Yeah, I would go to the patient's
I go to the
bathroom. I probably would.
What's the
Yeah.
problem?
Yeah, I would go and find out what the problem is.
Yeah, you got 2 hours before the next patient's being admitted to that other room you're cleaning, so you could come back to that. You got 2 hours to get back there.
Patient first, right?
Always, patients in front of you, always first. Okay, patient in isolation room is being discharged. There is not an immediate need for that room. You have 3 occupied patient rooms to clean. What do you do next? So the patient's in an isolation room, they're being discharged. There's no other immediate need for that room, and you have 3 occupied rooms to clean. What do you do first?
You do the 3 occupied rooms.
No, I go to the
No, I always
isolation.
do my,
I mean, if they don't need it, they say they don't need it.
Well, it's they being discharged.
So that means that, it's been discharged, but then we probably can't get.
You probably can do the other 3 real quick. I mean, it don't take long to do it daily.
Yeah.
You know what I'm saying? You go in there and do a wipe.
So you would go to the.
I mean, if they say they don't need it, I'll try to get them 3 out of the way, then I go do the.
I think that's the key in this scenario, that the fact that they're telling you, we don't need it for, we're not gonna need the room.
So,
That to me says you probably inquired to say, hey, do you need this room? They're not gonna usually just offer that information. So if you asked and they said, yeah, we don't need that till 6 o'clock tonight, get your occupied ones done, because you're making your happy customers there that are there. And then if you have time, get going on the isolation one. And if you don't have time, make sure you let the evening supervisor know, hey, I didn't get to this room. Your supervisor asks you to go immediately go to an occupied patient room. You notice a spill in the common area. As you head to the room, what do you do?
Just feel
You just have
first.
to get that
I
spill,
get the
'cause you don't-
spill.
yeah.
Always safety first.
Yeah.
You're always gonna get the spill, or at a minimum, if it's a small spill, put a wet floor sign over it, or have someone stand there with it until you can get back to clean it up. All right, but always clean it up and apologize to the patient for being late, and let them know that you were trying to avoid an accident,
Yes.
okay? Safety is always first. Your cart is running low on supplies, but you've been informed of a hazardous spill in a room where a patient was just transferred out, and there's an immediate need for that room. How do you proceed?
You do the room first, you get the supplies later, unless if you need supplies to do the room, then that's different.
Yeah, the hazardous spill is gonna be probably your first thing always, okay? So you're gonna work on that, all right? And if they don't have, if you don't have all the supplies to clean a hazardous spill, you're gonna have to notify your manager, okay? So the room is not occupied, they're talking about, so you gather up all the needed supplies to clean up the spill, and then communicate with the supervisor to seek help if needed. Or if you need safety data sheets, or how hazardous is this spill, really. But kind of assess the situation, and again, safety is always gonna be our first priority.
Okay.
You're almost done setting up your cart, but you need to immediately take care of an occupied isolation room before it causes harm. What do you do next?
Occupied one, a hazard.
There's a hazardous spill in an occupied isolation room. So what do you do next?
You go to the room, right?
Yeah, I'm going to the room and get rid of the spill.
Then you can still have your cart when you.
Yeah, I could finish. I'm going to the room.
So, I mean, what this is saying, the scenario answer really is use whatever you have available on your cart to contain or cover the spill. Ask for assistance if you needed within close proximity, or a supervisor to get you the missing supplies you need to clean the spill. So don't go running up and down, up and down, up and down. You're already up there setting up your cart. Call down if you need other supplies. to clean up the spill. Since the room's occupied, you don't really want to leave it unattended to go gather supplies. You want to get it taken care of. All right, okay, so those are just some scenarios that, that we could be faced with and some decisions you have to make, all right? You know, prioritizing is what this is all about, making sure that you're prioritizing patient safety and patients first. Okay, and everything else we can kind of figure out, but safety and patients first. So spills, blocked hallways, things like that that are safety issues have to be taken care of first, and then go on with your other daily tasks.
Okay.
All right, so what do we got going here for you guys?
We should be on 2.12.
Here we are.
Okay.
So common issues that come up while cleaning that require prioritization. So what are some common things that come up that require you to prioritize? Some common things.
A lot of common things.
Yeah, but you gotta make a decision. Do I do this first or that first?
Whatever the most important, I guess.
Right, but what are the situations that you come across in a given day? We just talked about like 10 of them that could happen. What's another couple ones that happen, say in your area where you're not sure, you know, which to do first? Becky, for your floor, you do laundry for a lot of people because they stay up there a long time.
Mhm.
Let's say you got a discharge to clean, but you've got laundry in for a patient who's discharged and is leaving shortly, but the other room's already empty and they're leaving and they need to get their clothes back. So what do? Do you do the discharge that's already empty, or do you finish the person's laundry? And
I'm doing that discharge. I'm sorry. I do the discharge and the clothes are come back because that's extra.
Yeah.
I always tell people it's not in my job description. I'm doing it because I
Right.
care.
And some of these things are not right or wrong. They're all about prioritizing, understanding the business of the facility, understanding the needs of the patient, asking questions, not being afraid to, you know, ask what the answer, what's right. You know, do you need the room right now? Maybe, again, if they know here especially, they know what rooms they need and they don't need. I'm on a call every single morning where they say how many rooms they need for the day.
Yeah.
So they'll tell you, we need 14 rooms today, and they know pretty much which ones they're gonna be. All right, so don't ever be afraid to ask nursing, you know, in what room is needed, and it might buy you some time to do something else. What are some other things that could happen throughout your day? That do happen. There are times when,
When do you have to leave an occupied room? When you say before you finish? When do you have to do that? If you're cleaning an occupied room, when do you leave before you're done?
If I leave,
Yeah, like say you're cleaning an occupied room, there's something that happens that say, oh, you have to come back. When do you have to leave an occupied room?
only if it's an emergency.
Well, no, like if a doctor comes in,
Doctor
right?
comes
Don't you
in.
have to leave?
Oh,
So-
yeah, that's respectful.
Yeah, so that's something that might come up, an issue that might come up. Yeah, you might have to, if a
Or
nurse
a
or doctor
family
come in.
member comes.
Yeah,
So those kind of issues.
yeah, it can be anything.
or there's other times when like, oh, we got, you know, a full staff today, everybody's got centers. And then at 9 o'clock, two people drop off the face of the earth, and now all of a sudden 2 floors don't have centers. So now you've got to kind of reprioritize your day, because now you got to do your own centers. So, yeah,
Yeah.
so those kind of things happen where you've got on the fly, kind of make decisions and understand what the priority and what isn't the priority. Okay? Okay, so quick review of what we just went over, and then we're gonna get you out of here. So what does HICS stand for?
Hospital incident.
Command system.
System, yep.
Okay, what is one action? And these are here, you can write them in, okay, on the last page, on 2.1, 2.13 for you. Okay, HICS, Hospital Incident Command System. Okay, what is
Yeah, right over here.
Over here, yes.
No.
It was,
Okay.
yeah.
Incident Command System? Okay. What is one action a technician or an ES worker can take when they hear a code for fire?
Move stuff out the way,
Yeah.
close the doors.
Perfect. What does RACE stand for?
I think it's. Oh, gosh.
Run.
No, you don't run.
Rescue.
Race.
It's rescue,
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 alarm, contain.
pull.
Contain and
Yeah.
evacuate.
Correct. Rescue, alarm, contain, evacuate.
Rescue alarm.
Yeah,
Yeah.
if you don't know it,
It should be
It's on
on
your
your badge.
Oh, okay, I know I seen
but
it.
you should know it.
Yeah, you should know.
So what's C again? Rescue
Alarm,
alarm.
contain,
Contain,
and
okay.
evacuate. Okay? Or it could be extinguished too.
Oh, that's part of the,
Yeah, that's why I said. I said
Regular
pull.
fire response. Okay, name a few actions you might be asked to take if you hear a code for an infant or child abduction.
The thing,
Yeah,
yeah,
that's what it is, but
Yeah.
what would you do?
we don't go look on phone, we
Yeah.
just
Yeah.
continue, do we? Unless
Matt
we
mentioned,
see
you
something on.
look in your area, be
Yeah, we see
alert.
something suspicious.
Yeah, just look around you. Look around you, see if you see something weird,
Mhm.
see someone run with a bundle of blankets into a stairwell,
You gotta
or
remember
something
that.
like that, because those are things that ways that people try to sneak out. You know, if you see someone with a small child, like dragging them by the arm, like racing towards the exit, that might be something. We don't wanna approach these people or stop them. Basically, we wanna call public safety. And what's the emergency number for public safety?
Hey.
No.
I mean, 3333.
Yeah.
3333, yes.
Wait.
So call them from 3333 and tell them where you are and what you see, okay? Your coworker is sick and just cleaned an isolation room. What do you do next?
Coworker's sick?
Coworker's sick, they're here, they're sick, they're coughing, they're hacking, they're sneezing, they're snotty and gross, and they just cleaned an isolation
I'm gonna
room.
ask him to
We'll
please.
tell the supervisor
Tell
again.
Yeah.
supervisor.
I gotta call
Because
supervisor.
we want that person to be safe and healthy. We want them to go to employee health and get well. We also want that room to probably be re-cleaned because we don't want the next patient.
Yeah.
I mean, it's happened before.
It has,
Well, we've
it
got calls saying our
Yes.
person's up on the floor sick.
has.
Yep, it's happened.
You're on your way to clean a patient room, but you notice a wet spill on the floor. What do you do first?
Good go.
Yep,
Get the spill.
yep.
The spill, safety first. What is a higher priority, cleaning an occupied patient room or the common area?
Occupied.
Occupied.
Yep.
Always, patient rooms are always gonna be a higher priority than the common
What's
area.
the common area is like waiting room and stuff like that?
Yeah, like the
Oh,
solarium.
Solariums, yeah.
Yeah, we want everything to be clean, but sometimes we gotta set these priorities, you know? Okay, so folks, that is it for today.
Great job, everyone.
Great job. I know it's a lot of information to get through. Tomorrow, we're gonna start promptly at 9. Okay, and we're gonna get through cart setup and handling chemicals. Let's see if we, those are just the reviews and the end. So we're
Matt,
gonna
can you
get,
put the calendar, just in case people forgot where the next room is?
oh, it's not here?
I'm not sure. We have a few different rooms, it depends. Let's
Okay,
see,
so
tomorrow.
Are we moving? Oh, no,
No,
we're
yep, so
257.
we're next across the hall.
It looks like we're moving though.
No, we're not. We were,
Oh, it's just on 2 different things. Okay.
yeah.
So 257, which is the smaller room across the hall tomorrow.
Mhm.
Then Wednesday, we're in the CSC building on the 7th floor.
Oh,
Okay, 7th floor is
CSC.
So we shoot
CSC.
off the elevators, right
Yeah,
across from the
on
elevator.
Wednesday.
building that I want?
Yeah, in your building.
And then back here again on Thursday to finish up.
Yeah.
Okay? And then again, once we finish this up, I'll get all your information in to AHE, and we will like to probably have the test session sometime in the next 2 weeks, because we want it to be fresh in your mind. All right? And then again, we'll give you any things you want to take home of like the cards, or as we get through, there's a game at the end that we play with like flashcards. Answers to a lot of these questions. I've had, like last time I had someone wanted to take them home and study them, and they did, and I think they found out very helpful. And you're welcome to, certainly welcome to do that, all right? So tomorrow we'll get through at least modules 3 and 4, if not 3, 4, and 5. And I appreciate your time and patience today.
All right.
Take your books with you, that is your book to keep. Do not lose it.
Bring it
It's
tomorrow.
one of a kind, and make sure you bring it tomorrow.
All right, so we can take our break, right?
What's that?
We can take our break.
No,
Ah!
Wait,
what you need enough break for? We took breaks in here. We took,
We had
we
enough
took
breaks.
enough
I
breaks,
mean,
Mom.
if you got
We have to use the restroom or something.
Yeah, use the restroom, go.
Yeah.
Take 5,
We
10
took,
minutes.
yeah, we took our breaks. We just didn't do them at the normal time.
Take 5, 10 minutes.
Yeah.
I mean, on your way to your area to help out. You can help finish a couple
They
discharges.
gonna help out like 5 minutes, I know.
No, we got discharges and stuff. All right.
Okay.
Thanks, Rita.
Not paying attention. I said they probably weren't paying attention. Mhm. Keys to get started? Oh, there is? Okay. Oh, okay then. All right. Hey, Stefan.